Results on the third grade reading, fourth grade math for this past spring. Passed them out to the committee, so you find that in your papers.
Very good. Also, I'd like to just say welcome to education. Glad to see you guys. Hope we have a decent meeting. It goes quickly. There's a break at 10:15, and we're going to move item number 9 to immediately after the break. Item number 9 is the recommendations to the Mental Health and Vulnerable Task Force. Those people would like to get on the road. They live a little farther than I do away, but not much. So we'll accommodate them and get them going home. And with that, that's the only change on the agenda. Okay. Of minutes that were from the last meeting, has everybody had a chance to peruse them?
Mr. Chairman, I'd move to approve.
Second.
It's been moved and seconded that we approve the minutes as published.
Mr. Chairman,
Go ahead.
there are a number of minutes, so you haven't approved any for this interim, so I think the motion needs to be for the 2024 interim minutes.
Mr. Chairman, I'll amend my motion to be the approval for all 2024 interim minutes to be approved.
Ooh, good job. Not going to take them one at a time.
I'll amend my second to second that.
Okay. Any discussion on it? None appearing, we'll proceed to vote. All those in favor of the 2024 minutes, please say aye. Aye. Those opposed? Very good. We've approved a whole bunch of minutes. I thought that was in there just so we have a nice reminder. Okay, so we are now at item number 2, which is Medicaid and Child Health Insurance Programs. We have Tanya Hytrek, Operations Administrator from LSO, and Matt Wilmarth, Senior Financial Analyst. It's all yours. Take it away.
Great. Mr. Chairman, good morning. You introduced me, Tanya Hytrek, Operations Administrator with the Legislative Service Office. Before you in your meeting packet, you have 25 LSO 0095, Committee Formal Draft 1.1, Medicaid and Child Health Insurance Program Billing. You'll recall that you heard a version of this bill draft at your August meeting. And at that August meeting, you requested staff amend the bill draft to include billing for child health insurance program expenses, delay the effective date until July 1st of 2026, and add a position for the Wyoming Department of Education staff to assist school districts in billing. I'll go ahead and briefly walk the bill. The contents are exactly the same from the August meeting with the exception of those provisions that I just mentioned. Section 1, page 2, line 1 through page 4, line 11, amends subsections H and J of Wyoming Statute 21-13-321. Page 2, line 9 modifies the implementation date from 2025 to 2026. Page 2, line 11 adds what's commonly referred to as CHIPS services. That's the acronym for it. The same with line 17, lines 21 through 22, and also on page 3, lines 5 and 6. Moving on to page 4, line 1, this is modification of the date, pushing it out an additional year. Lines 3 and 7 and 8 also on page 4, add CHIPS again. Page 4, line 13 through page 5, line 8. This is a new section authorizing the Department of Education 1 FTE to assist school districts in billing and obtaining reimbursement. There's an appropriation of $255,250 from the general fund for salary and benefits. The appropriation begins on July 1st of 2026 and ends on June 30th of 2028. This line item and the position will be incorporated into their standard budget pursuant to this section. Section 3 on page 5, line 10 pushes out the effective date again to July 1st of 2026. So subject to your questions, Mr. Chairman.
Does any committee member have a question for staff? Go ahead, Chairman Scott.
Mr. Chairman, appropriation from the general fund rather than the foundation program. Refresh our memories, how do we normally fund the State Department of Education? Why is this one general fund?
Go ahead, Matt.
And Mr. Chairman, Senator Scott, certainly a policy choice on the committee's behalf. Generally, the Department of Education staff are primarily funded through the general fund. There are some FTE that are funded by the School Foundation Program account. But generally, a majority of the staff in the Department of Education are funded by the general fund.
I suppose the Appropriations Committee will do what they want to with that appropriation, but is there been any general principle that's been used in the past that you know of as to which is which?
Go ahead, Matt.
Mr. Chairman, Senator Scott, regarding these positions, you may recall there is a position within the Department of Health that's funded through the I believe it's through the School Foundation Program account. It may be general fund. But I know there is some appropriation for this program through the Foundation Program account to the Department of Health. It's, again, certainly a policy choice. There is not a written formula on which positions are funded through the Foundation Program account or through the general fund. It's certainly a policy choice.
Mr. Chairman.
Go ahead, Mr. Chairman.
So trying to understand this, we haven't had there isn't any statutory principles that have been enunciated, but have there been any informal principles as to which is which, or is it just sort of a catch-as-catch-can thing that's grown over time?
Mr. Chairman, the legislature has taken an ad hoc approach to this. There's not really a set principle as to which funding source.
Further questions? Go ahead, Senator Sproffles.
Thanks, Mr. Chairman. Along those lines, tracking where the money will come back. So if we get reimbursed through Medicaid, but it's special education dollars that would effectively be reimbursed, are we going to realize the savings on the School Foundation Program account entirely, or are we going to end up having some savings realized where the Medicaid will end up back with the Department of Health or with a general fund source?
Go ahead, Matt.
Mr. Chairman, Senator Scott, any proceeds, the net revenue will be deposited within this Public School Foundation Program account. That's a requirement of the current statute. So theoretically, you could certainly say we're gonna offset this cost through those proceeds.
Yeah, thank you. So all savings will go to School Foundation Program. That makes sense. Thank you. Appreciate that.
Mr. Chairman, just from a refresher point, at the August meeting, we provided a memo on the student enrollment and the 2,500 student threshold. Again, just a reminder to the committee, that's approximately 9 school districts or 61% of the total student enrollment from the 2003-04 school year. So I wanted to reorient the committee with the number of school districts and the percentage of students that this would impact under the mandatory participation threshold.
Okay. Further questions for staff? From the committee? Okay, none appearing, we'll go back go to public comment. Thank you.
Yeah, Mr. Chairman, you have folks from the Department of Education and the Department of Health
Yes.
that
Yes,
can speak
you're
to
right.
their presentation and implementation.
You're right. Thank you. So we'll take it up to the Department of Education.
And while they're getting set, let me warn people that with these pillars here, if you're behind the pillars, sometimes we cannot see you and we'll miss you. And Mr. Shaner was behind the pillar there.
Good morning, Mr. Chairman and committee members. Dickie Shaner with the Department of Education, and I'm joined by our Chief Operations Officer, Trent Carroll.
Good morning, Mr. Chairman, committee. We're basically here to answer questions this morning. I know the Department of Health has a report that they've put together and a presentation that they'd like to cover that I think will provide a lot of the information you're probably looking for. So we won't duplicate any of that this morning, but we're happy to answer any questions. And would also like to just mention that the position that's in the bill, we feel that it would be a better idea for that funding to be appropriated to the Department of Health to contract with a provider that can assist school districts with the billing. There's a vendor that's already working in the state that does that, that 42 out of the 48 school districts currently use for IEP documentation. They do this work already in Wyoming with some early childhood providers and also in the state of South Dakota. So it might be that vendor or a different vendor, excuse me, but there is a Medicaid match that's available if it were structured that way. So some of those costs could be recouped through the Medicaid program at the 50% match rate. And I believe with technology, it's an even higher percentage of 90%. I think the Department of Health will speak to that, but that's one thing that we wanted to bring to your attention. Happy to answer any questions.
Very good. Questions for the Department of Education? Anybody? Go ahead, Scott.
Mr. Chairman, so recommendation as well as the health departments that instead of putting a position in Department of Education, a new position, that we switch it to contract series money and put it in the Department of Health. And they've got a vendor that they can get at that will do this effectively. Is that, am I understanding what you said right?
Mr. Chairman, that is correct.
Okay.
Further questions? Anybody else? All right. Thank you. We'll have the Department of Health come up and finish it off, please. Good morning and welcome.
Good morning. I'm Jesse Springer from the Wyoming Department of Health. I'm the Deputy Division Administrator for Healthcare Financing. I have Sarah Rogers here and Justin Browning. I also have our Medicaid Director behind me, Lee Grossman. We have a presentation that is answering some of the questions that were asked from last meeting. So I'll just wait till I can get started. You know, our goal was just to answer those questions and explain the extra revenue that would be generated by the changes in the bill, such as adding CHIP or the other changes.
Good morning, Mr. Chairman, members of the committee. My name is Sarah Rogers. I'm the Benefits Management Administrator for the Division of Healthcare Financing, Department of Health. I'm happy to be here this morning to provide you some updates and answers to questions that you asked us in the August meeting. So I'm just going to go through a couple of the first slides here, and I'll turn it over to my colleagues to address some of the numbers questions. So at the June JEC meeting, we were asked to follow up on several questions. So those were what services could be covered by Medicaid, what would district participation look like for those over 2,500 students, and then what are the fiscal costs and benefits of Medicaid school-based services on net. So this bill would require districts with 2,500 or more students to bill Medicaid for school-based services. Based on the 2024 enrollment estimates, this would require 9 districts to participate, which compromises 61% of total students. And then the smaller districts could still continue to bill voluntarily if they chose to enroll with Medicaid as a provider and bill us directly. And then as far as the question regarding what services are covered and are eligible, so services eligible for reimbursement are outlined here in this table. So those services include audiology, counseling, speech and language pathology, orientation and mobility, occupational therapy, psychological services, physical therapy, school health services, school nurse services, and school social work services. I just wanted to note that there are 2 services here that could be covered that we currently are not covering, and that is non-emergency medical transportation and personal care services. So those are able to be reimbursed through school-based services. However, we would need to submit a state plan amendment to add those services to be covered under Medicaid. I'm going to turn it over to Mr. Browning now to go through the next couple slides.
Please. Go ahead, Chairman Scott.
Mr. Chairman, now, obviously, these services are only reimbursed if provided to children that are Medicaid or child health program eligible. Are all the services on that list that those kids get, are all of them that the kids get, are all of them eligible for Medicaid, or are the Medicaid regulations such that some of them are, or some of them are not?
Mr. Chairman, all of those services, as long as those services are being provided by an enrolled Medicaid provider and provided to an eligible Medicaid client, then yes, they are billable to Medicaid. I can't say that all those services are currently being billed to Medicaid. I know the majority of the services we see are in the behavioral health realm, and maybe some therapies, but I think that's the majority of what's actually being billed.
Okay. Senator Scott, or I'm sorry, Senator Rothfuss.
Thank you, Mr. Chairman. Before we go on the 2 services, the transportation and the personal care services, we would need to submit a waiver. What would the projected financial implications of that be? How much would we expect to see those services provided? And the second question would be, why haven't we, and it's probably related, why haven't we submitted those requests?
Chairman Northrup, Senator Rothfuss, when we originally did the studies, these services were not included in the studies. I don't know if the guidance at the time from the federal government was unclear on these services, but we had not included them in estimates or those type of things. And we can't cover all transportation, so kids have to get to school. But if they are in a special medical bus, then the extra costs, like the differential cost of that, we would need to calculate. So some children actually need a lot of special equipment in that, or an extra attendant that's actually, in the medical type bus, or it's a special type of vehicle. Those extra costs could be covered. And so we actually don't have a very good sense of what those costs would be at this point. But if this was added, we could go through and calculate those and just make it a billable service. Likely like a per trip with a mileage is what we would do. And then personal care, it's usually billed 15 minutes. So it's an extra attendant that's only there because the child has medical needs. So it's not a teacher. It's that a child needs an actual attendant because of their physical needs. Then that attendant could be billable. And that's something that would not be needed by another child that doesn't have those special needs. So that's the sort of thing. In other parts of Medicaid, we do pay for personal care type services, and usually those are like attendants for somebody who needs it for their physical needs.
I'm not sure how much of the transportation would take place, but that latter example seems like it's tremendously frequent, realistically, where you've got somebody that is assigned as a para or support for an individual through their IEP. Obviously, it doesn't matter, these details don't matter with regard to the legislation, since the legislation is going to be based on whatever we're billing as the state. But is there a plan then to do a little research, figure out what this would end up leading to, for potential savings and then potentially proceed with that waiver request, or what are you all looking at with regard to these two categories?
Please go ahead.
Chairman Northrop, Senator Rothfuss, these are really, there was two requests. There's requests to look at changes caused by the bill, and then also changes that we could do administratively that could make the program more efficient or more productive. And these were kind of in that second group that we could do administratively to expand how much districts could bill or services that could be covered under existing authorizations. So we absolutely could go study those more in depth, really trying to find the districts that are going to participate and then looking at the costs that could be billed. So, I think if we broaden this and said, if you have a medical type vehicle, this is how you can bill per trip for that. If a child's needing a personal care attendant solely for those medical needs, it's not a teacher. We can't pay for instructional costs, but if it's there because the child has medical needs or possibly behavioral needs, then that could be covered.
Go ahead, Representative Berger.
Thanks, Mr. Chairman, and thank you for being here. But the question I have deals with, access to these services. I think we're talking about paying for these services, but how does this change for access for these services? Are students with IEPs not getting the services needed, and will this give us, by voting for this bill, will it help those with IEPs be able to better access these services? Or are we already accessing the services? And I might have a follow-up.
Mr. Chairman, Representative Berger, so this program does not affect what services are being provided to students. It is simply an opportunity for us to recuperate federal funds for something we are already covering.
Okay.
Chairman Scott, please go ahead.
Mr. Chairman, so am I right in thinking that a different way to look at that, what you just said, is that this bill doesn't expand the scope of what government does at all? What it does is shift some of the costs from the Wyoming state government to the federal government. Is that correct?
Mr. Chairman, Senator Scott, that's exactly right. It's essentially a cost savings program for the Department of Education.
Very good. Go ahead, Representative Brown.
Thank you, Mr. Chairman. Mr. Browning, so while it looks like it may be, this is probably the fourth or fifth time we've had this discussion in detail with this committee. And my question is the juice worth the squeeze? It seems to me like we're going to layer yet another portion. No, we're not actually increasing what the state is doing, but we're adding a layer of complexity, not only to the Department of Health now, but also to our educators on what they're going to have to do. We don't have this as a fiscal note yet because it hasn't gone through that process. Do you guys have a rough understanding of what this is going to cost us to implement as we walk through this process? And then if we do have that, do we have a rough idea of what the return projection is? And is that juice worth the squeeze?
Please go ahead.
Mr. Chairman, Representative Brown, yes. In the next couple of slides, we will see some projections on costs and revenue, as well as our proposals for program simplification to ease administrative burden on our districts.
Anybody else have any questions on eligible services? And if not, we'll move forward and go into the cost savings. Anybody? All right, please go ahead.
Thank you. Well, that was a great introduction, Representative Brown, to our next slide. So as you can see on this page, we are projecting roughly $2.8 million in annual reimbursement for this program, leading to 5.6 in the biennium. On the high end, we are estimating roughly $500,000 a year in additional administrative costs. That's going to be based on district employees billing on behalf of roughly 60% of their eligible students for this program. And the way we got these numbers is based off of hours that were allocated at Converse County School District Number 1 when they've participated in this program. And so we adjusted those numbers to reflect the numbers at the 9 largest districts. And so with the 500 annual cost or 500,000 annual cost and the million per biennium, we estimate it'll bring in about 4.6.
Chairman Scott has a question.
Mr. Chairman, Mr. Chairman, and my question is on that administrative costs figure. And let me give you a little background. My late wife worked for the Child Development Center in Casper, had to fill out Medicaid forms on exactly this sort of thing. And she was a physical therapist and had to keep much more detailed notes than she would otherwise have, and had a fair amount of paperwork because of Medicaid. Are those two questions? Has the burden of that sort of thing, record keeping by the professionals involved, has that gone up or gone down in the past 20 years? Because that, my information there is 20 years old. And second, in your administrative cost figure, have you got an estimate of the professional time involved that is in the cost of what they have to do in record keeping, or is it a narrower definition of administrative costs?
Go ahead, Mr. Browning.
Mr. Chairman, Senator Scott. Yeah, so that those costs up there do account for the administrative time, which would include the record keeping. And back in 2022, the Department of Education, in conjunction with CMS, they released a guidance on school-based services. And part of that discussed the records keeping and the requirements for IDEA versus what's required for Medicaid. And essentially they mirror each other with the exception of Medicaid also requires the date of service to be included in the records as well as the student's Medicaid ID number. Otherwise, as long as the services are medically necessary and the notes reflect that, the record keeping should be fairly similar.
Okay.
Mr. Chairman.
Representative Brown, sorry, not Brown, Representative Berger, it was a B.
Can I make just a quick comment to what Mr. Scott had asked? What
Certainly.
Chairman Scott had asked?
Quick comment.
Just to tell you that the streamlining of reporting and the technology has gotten really good. And it's getting better. So that piece, yes, it is a concern. A couple years ago, it's even much quicker, and it's really not so burdened. I guess my question is that what I'm hearing out there and what I'm seeing from my colleagues and others around the state, it's not the burden. It's not so cumbersome to report anymore. Is that correct? Is that fair to say?
Chairman Northrop, Representative Berger. The design of this is intended to use the existing record keeping that's done for 100% reimbursement and just map that existing record keeping to Medicaid billing. So the idea is to use those existing electronic special education systems and to do the mapping one time in the back end. So each staff member is not saying, I want to pick this procedure code. So we'll get to that simplification. That was not done originally because the work groups we had with districts indicated they wanted to have access to all the diagnosis codes. There's 10,000 diagnosis codes. They said they wanted them. They said they wanted access to a much wider range of procedure codes. So we opened them. Now at this point, we're suggesting that it actually just be a one-to-one. If you're a physical therapist, there'll be one procedure code, one diagnosis code. And that then can be automated. There's no medical discretion needed. There's no risk of the provider in having made the wrong decision, because that will have been automated between the Department of Education and the Department of Health. And we will be directive of saying this is the procedure build, so that if they say that that was not the procedure that was correct to build, then that would have been an administrative mistake at the state level, not at a district level. So, and that's trying to alleviate some of those concerns. It says, I'm a school psychologist. I would prefer not to be making medical decisions. Some of those things are just being simplified. And we do have some slides on that, and I think Justin will get into that. Is there any further question on this slide?
That's all right. All right, so let's go to the next slide, please.
So based off feedback that we've received, both from our participating district as well as the concerns from providers within other school districts, is the administrative burden, of course, associated with this program, as well as the fears of providers having to select diagnosis codes, select procedure codes associated with the services they're providing. So we've done some research, and we've spoken with CMS, and we're looking at moving forward with this program with a simplification. So we are going to remove the majority of diagnosis codes for the school-based services program and only have one diagnosis code for all students, and that would remove the provider's decision of diagnosing the child or having to select that diagnosis. We are also looking at having, like Jesse said, one-for-one for procedure codes. If they are a physical therapist, there will be one physical therapy code for them to select. If they are a mental health provider within the district, there's only one mental health code. And this should eliminate the vast majority of the administrative burden associated with this. So as the IEP team or IFSP team is developing the plan and they have that parental consent form on file, then they can just go ahead and select the diagnosis code, the one code for this program. And then as they're entering what services are going to be provided to the student under the IEP, they can go ahead and select the procedure code associated with that provider type. And so this would reduce the burden and also ultimately reduce the administrative costs, because providers aren't going to have to really think about what they're selecting for this program, because we'll have that guidance of the one-to-one.
Senator Scott, or Senator Rothfuss.
Thank you, Mr. Chairman. And let me start by just saying that that is brilliant, and thank you. That I think that's going to assuage 95% of the concerns that we've been hearing about this program over the years. But the question I have relates to who would be making that decision. One of the challenges that we've had is that a lot of our providers don't want to go through the administrative trouble of taking Medicaid just based on the headaches. They're a small provider. It sounds like this is being structured in such a way that it obviates that entirely, so that it's independent from whether the direct provider takes Medicaid, since it's a relationship between the district and the Department of Health. Am I understanding that correctly?
Mr. Chairman, Senator Rothfuss, so this money never goes back to the providers. The providers are only acting as our rendering providers, and it's the school district that's the billing provider. So the bulk of these providers within our school districts don't bill in the private industry. So whether or not they accept Medicaid is irrelevant. They still need to be an enrolled Medicaid provider in order for their services to be eligible to be billed to us, but that doesn't mean they need to be billing outside of the school district. In fact, a few of our provider types, such as school counselors and school psychologists, aren't even eligible to bill outside of the school-based services program. Only under the district's taxonomy are they able to bill.
Senator Rothfuss.
On the other side of that, though, where perhaps you have a specialist, and maybe the codes don't even allow for that at this point, but if you had a specialist that did limited work for the district, how would that end up playing out where you have a specialist that doesn't bill Medicaid, but they do work with the school district? Can you talk through the nuances of how that would proceed under this program?
Mr. Chairman, Senator Rothis, so the provider would still need to be enrolled with Wyoming Medicaid. And again, the provider themselves will never be billing us. It'll be only the district who will be billing us directly.
So they would have to at least get approved through Medicaid to provide Medicaid services, but they wouldn't have to be filling any paperwork out. So there's the step to register with Medicaid, but nothing beyond that would be the obligation.
Mr. Chairman, Senator Rothis, that is correct. They will still need to document the services they are providing and do the initial paperwork to obtain their NPI and become enrolled with Medicaid. But other than that, they don't need to be accepting Medicaid outside of the school. They would just move forward as normal.
Thank you, that's helpful.
All right, thank you. So, well, I guess we're at any questions. If there are any additional questions or comments from the committee, we are happy to discuss.
Yeah, on a separate question, nothing in the way this is structured provides any of the funds of the $500,000, for example, of estimated administrative costs for the districts back to the districts. All the savings, so to speak, goes back to the state. There's an intimation somewhere in your slides that they're already doing this work anyway, but you're counting the administrative costs. So I'm interpreting that as it's not an excess administrative cost, but it's an associated administrative cost. My question, and this will be for the school districts also, is should we be leaving some of that savings with the school district so that they have additional funds available to administer it from within the school district instead of having to do it with the resources they have right now? And if you have thoughts on that, I'd appreciate them, but I'll ask the school districts the same question.
I'll go first, Mr. Chairman, Senator Rothis. So currently, all administrative costs associated with school districts are reimbursed by the Department of Education. So the districts would bill the Department of Ed, whether it's for an administrative assistant working in the system, that assistant's time would be reimbursed, or the provider, anytime they're doing for the documentation or for the selecting of the codes. I'm going to pass the baton over to my colleague.
Chairman Northrop, Senator Rothfuss. So I think with the suggestion of WE to shift where the some of the administrative expenses are budgeted, for instance, this $70,000 of software licensing, the thought would be that the Department of Health would work with WE to actually directly contract that statewide, and that would no longer be a district cost. That would be just directly paid. And given, we'd have to chase some approvals, but, if we do it as a technology module, it'll be at 75% federal match, for instance, 90% for the original licensing. And then, operating costs, if we have like a statewide biller contract or something like that, a few of these vendors are not only software vendors, but they also add extra services to help districts with Medicaid billing in other states. So, thought is we could actually use those contractual services for a statewide contract to help the districts there. So that would actually no longer be a district cost. That would be a statewide cost that would no longer be on the district's books needing to be reimbursed. So those are, from the appropriation that was in the bill, if that was shifted to contractual services, I would suggest it be budgeted at 50% federal match, which would reduce the appropriation by half. And then you would add federal funds is the way that if in our other committees, and so we can get language for that if that's needed, or work with LSO on that if needed. But it's essentially, the amount that's in there, instead of the biennial amount being it would be half as much, essentially.
If, Mr. Chairman, follow up, if one of our largest couple of districts decides, hey, we need a full-time employee to administer this, I guess the first question I would say is there any possibility of that? It sounds like it's streamlined enough that maybe that isn't the case. But if that were decided by the district, that would be compensated for through the existing way that we fund special education, and it would be 100% reimbursed. Is that what I'm understanding?
Mr. Chairman, Senator Rothis, already districts have that opportunity if they were to participate in this program. They could hire a staff member, from my understanding, hire a staff member, and that would be reimbursed through the Department of Education under the administrative costs for school-based services.
Okay, and the final question, follow-up. If we shifted it over so that the funding was coming from the Department of Health on that line, would we potentially be available for the administrative match associated with Medicaid? So we should even be moving that possibility over also, because we theoretically get a 50% FMAP on, not 50, what is it for administrative? Anyway, the administrative cost FMAP, would we be getting that if we were reimbursing through the Department of Health instead of the Department of Education?
Chairman Northrop, Senator Rothfuss, so the actual cost of the district would not be reimbursable because we don't reimburse providers for their administrative cost. In this case, we can provide lots of systems and assistance, but we generally are, so for instance, like when we came up with this $430,000, it's adding basically 15 minutes across thousands of children per month. So you have all your medical providers, they have an extra 15 minutes a month per child is essentially what we estimated. So if they are seeing 10 children, there's 15 minutes. So that's where the cost came from. It's just the sheer volume of that 15 minutes spread across a huge number of people, of district employees, the actual treating. We only estimate about 20 hours or less per billing office work to load it, review it, submit the claims, because it's all automated, honestly, from the software at this point. So that piece is not where the time is coming from to actually have like a back office billing person. Most of this $430,000 is coming from, there's just thousands of children. And so each child has 15 minutes of essentially extra record keeping to just review your notes and make sure that you've noted why the service, right, and maybe this could be reduced if once people get in the practice of it, but just to not just write the educational benefits of what you were doing, but to note, I worked with mobility if you're a physical therapist. I mean, it's implied that when you're getting a physical therapist, you're working on physical therapy, but that's the sort of thing that we were trying to expect. And that's actually what drives most of the cost, not the actual admin, the billing office type workers. It's actually all the direct care staff basically having to spend 15 minutes a month per child.
Chairman Scott, please go ahead.
So am I right in thinking that, now we do have one district that is participating right now, is my understanding, but basically we're not participating in the Medicaid reimbursement. Am I right in understanding we are the only state in that category that everybody else is doing it?
Go ahead.
Mr. Chairman, Senator Scott, can you please elaborate a little further? Can you please explain your question?
Well, my understanding is that in general, with one exception, for our special ed costs, we are not participating in Medicaid and getting reimbursed by the feds for that. That my understanding is that every other state in the union is. And so we're an outlier on this one.
So, Mr. Chairman, Senator Scott, yes, we are the only state that doesn't allow districts to keep at least a portion of the Medicaid reimbursement. So the 49 other states and a few territories actually either allow districts to keep 100% of that reimbursement or a certain percentage so that they have that financial incentive to participate and be able to cover costs within the district.
And, Mr. Chairman, my understanding is that the nature of the reimbursement system we've got, because of the court decisions, the Campbell decisions, is the cause of that. Is that correct?
Yeah, Chairman Northrup, Senator Scott, the other states also don't have 100% reimbursement for special education. So the other states are billing so they can actually fund their basic special education services. And so they're very engaged. You know, the districts are actually the ones going to the school-based services conferences for Medicaid and learning how to bill better. And because they keep the money, and that's actually the only money they're getting in some states, depending on their funding levels, to fund special education. So we're not suggesting you go to that. This is a way to make sure that, you know, I'm trying to remember the original justification for this, but it was basically to create a funding source to maintain that policy, to maintain the 100% for special education policy, and to create that the fund that's funding that would actually have a revenue source. Hopefully that answers the question.
Anybody else have any questions for the gentleman? Going once. All right. Thank you, guys. Does anybody on the committee have any questions in general for either the Department of Health or the Department of Education? Representative Berger, please go ahead.
Yeah, I have a question for the Department of Education,
Okay.
Mr. Chairman, if I
think
may.
that if you give them a moment, they'll be right there.
Yeah.
Please go ahead, Representative.
Yeah, thank you, Mr. Chairman. And the question I have is some of the districts, or well, I believe, I would think most of the districts that would be participating in this, where is the cost, they think the cost savings is going back to them. And the way I see it, and correct me if I'm wrong here, is that it's not necessarily the cost savings, it's going back to the Department of Education and getting this money, this Medicaid money, to go back to the department so that we can continue to reimburse special education at 100%, so that we stay focused on helping our most vulnerable citizens in our state. Am I fair to say that?
Mr. Chairman, through you, Representative Berger, your interpretation is correct.
Okay, yeah. And that's a good thing, we're correct, Mr. Chairman? That's a good thing? It is? I'm seeing some, that is, I mean, that's what I'm asking. That's a good thing, correct? Is that?
Mr. Chairman, through you, Representative Berger, I'll refrain from weighing
Okay.
in on that.
Yeah,
but
that's fine.
Let me see if I can rephrase his question just a little bit. What we're doing is on an annual basis, talking about getting 2.8 million in reimbursement from the feds, right? Or is it half of that? Because we got a 50% FMAP.
Mr. Chairman, that's correct, per year.
We're getting that per year at the cost of increasing the government expenses by $500,000 roughly a year in additional administrative costs that we're getting. So the net benefit to the state taxpayer is 2.1 million, but we're not increasing the cost of government by anything other than that administrative cost. Is that a right summary? Because we're gonna have to defend this. We take it upstairs.
Yes, Mr. Chairman.
Okay.
Okay. Good question. Any other questions for Department of Education? Anybody? Okay. Thank you, guys. And now we'll go to public comment. Line them up, fill them up, whatever it is.
Mr. Chairman, Boyd Brown, Wyoming Association of School Administrators Executive Committee, or Executive Director. Just want to say a few words here. First, I want to thank both the Department of Health and the Department of Ed for their thoughtfulness and the way they've looked into it. I think the single code takes away a lot of worries that districts had out there. Again, I would support their recommendation to put the position over in the Department of Health where they have more Medicaid people that they would be able to work with, and districts would have more resources there. So support that as well. The idea of it only costing about $500,000, I'm not sure that's exactly where we will be with it. One of the things that we currently have as a problem is hiring those people. So we have people that have a huge caseload already. Sometimes we have positions in our special ed departments that go unfilled all year long. Trying to make sure that we get everything covered may still be a problem. Well, not may, it will still be a problem. So I'm not sure that the 500,000 is a correct one, because if we're looking at hiring more people in the districts to provide those services, we may not be able to find them. And increasing the workload is going to be an issue. But again, I think it's been well thought out, not speaking against it, just wanting to try to give you where everything's at. The $2.4 million that I think that we would be looking at saving is about 1/10 of the school foundation program. So just putting it into perspective for you there, I don't think that there's anybody out there that's real opposed to it. I think it's an unknown. I think that they've answered a lot of questions that we had about how we would code that and where we're at. I do want to speak to it allowing us to keep 100% reimbursement. And I believe that was a few years ago when we had frozen special ed at the level that it was at. So I don't think at this point that that's a question about being 100% reimbursable anymore. I believe that what Chairman Scott said is exactly where we would be at. That money will go back into the school foundation program, is my understanding of everything. And with that, I'll answer questions.
Chairman, for Dr. Brown, or a question for Dr. Brown?
Thank you, Mr. Chairman. So when the further you push the money away for who's responsible for paying it, it seems like the less incentive there is to control that process up front, and that is when you determine or decide who's on an IEP or who isn't. What is our control mechanism at that level? I see in one of the schedules that was presented to us here that, like in my county, Natrona County, 56% of the students are on IEPs of some sort. And then there's another district there where 34%, I believe. How do you account for those differences in the evaluation of kids, and who within the government controls that part of that diagnostic piece?
Mr. Chairman, Representative Obermueller, the IEP process is very structured, and I'm not sure where your percentages are coming from, because statewide, I think it's about 14%, 13 to 14% of our students statewide are there. I think the number that you may be talking about is that it may be the percentage of students that are on special ed that may be Medicaid reimbursable, and I'm doing that from memory from just reading through things. And again, I think that's going to depend on parental consent to be able to do some of this as well. So, and I will see if that answers the question that I think you're trying to ask.
I believe the health department. Those percentages included Medicaid and CHIP programs, so. So I'm not sure. I mean, I personally don't know how that functions within the state government of how those pieces are monitored and checked. I'm not sure there's a question.
Mr. Chairman, Representative Obermueller, again, I don't know how those numbers came across. My assumption is they're using the codes that we already have in our special ed software to say that these students would be eligible for Medicaid services based on the services that they're providing, and then also if they are CHIP eligible. And that's my assumption. I think the Department of Health may be able to answer that better than I can.
Yeah, Mr. Chairman, yeah, I think that this is one of the slides at the Department of Health, but we didn't get to, when they did their presentation, they didn't get to that slide. So that's probably why, you know, the confusion on my part is that actually hasn't been presented to ask questions about.
Would you like that Department of Health?
I would, yeah.
You guys want somebody, please?
Chairman Northrop, Representative Obermueller. So in 22-23, the department worked with Department of Education to do a data match to identify the percentage of children that are on IEPs, and then to go deeper, to go and look at what insurance source do they have, and are those kids are on Medicaid or CHIP. So the data match, I think the slide you're looking at has 9,677 children that were on IEPs in school year 22-23. Our data match and then the estimate of adding CHIP to that came up with 50.3% of the children that are on IEPs are also on Medicaid. And you might think, well, is that because all the children are low income? No. A lot of children qualify directly for Medicaid because they have a disability. So that's why that percentage might be higher than the statewide percentage of children that are low income or whatever. For instance, children might qualify for Medicaid because they have a developmental disability, or they might qualify for SSI. So those are auto-qualifying conditions to be on Medicaid. So that's where you get to maybe a higher percentage of children that are on IEPs also being on Medicaid and CHIP.
Yeah, Mr. Chairman, yes, that does answer my question. When I looked at that schedule, I was taking those percentages as relating to the IEPs and didn't realize that these two columns didn't work together.
Chairman Northrop, Representative Obermueller, there was a much larger report, so we tried to make it simpler, but you kind of lose something when you do that distillate, when we try to distill it down, that, it loses some of that explanation. So I appreciate the question.
We got them up? Anybody else? Thank you, guys. Okay, we're back at public comment. Dr. Brown, had you finished? Thank you. Anybody else?
Chairman Northrop, I'm Allison Robertson. I am from Natrona County School District. I am not here for Natrona County School District. I'm speaking on my day off. One of the things that I heard asked by Senator Rothfuss is, who's gonna do the work? Can we hire someone? Our services are spread so thin right now, and our teachers are overworked incontrollably. When we talk about 15 minutes a day per student or per month, where is that time going? And my only concern is, if we don't hire someone, who's doing the work and who's getting kicked out of the services because we just don't have enough time. There's only so many hours that you're at school to do the work, and those 15 minutes are precious moments that we're working with kids. And so taking time for recording this stuff somebody's gonna have to take that responsibility, and our sped departments are overloaded. We're hiring more counselors, we have more social workers in our school. They're just barely being able to meet needs of students as is. And so I would strongly consider who's doing the work, when's the work getting done, and is putting more paperwork on them gonna solve the problem, or just make it harder for them to do their job? For that, I stand for questions. Thank you.
By Scott, seconded by. Anybody? Well, I'll second it so we can vote on it. Any discussion then? Mr. Chairman. Go ahead.
Mr. Chairman, I was going to just ask to speak my mind and why I guess now I'll vote no. It's the same reason, it's the same song and dance that we've had on this discussion for the 8 years that I have had this topic in discussion. And the last speaker that just mentioned this is exactly right. And I'm just to the point where $2.5 million a year it's a significant amount of money. But what it costs us in the long run for our teachers, our school nurses, everybody else that is dealing with these students on IEPs, for the state to get some money back, it's a symptom of us having such a small population. And it's one of the issues that we have that we're going to continue to deal with. I would also say that this also boils down to the fact that the state of Wyoming has chosen to do the 100% reimbursement. And that was the discussion 4 years ago when we had this exact same bill. 100% reimbursement, there is no incentive, right? And so for us to get that $2.5 million back, it's going to cost us a little bit, whether it's the Department of Education, the Department of Health, or at the school level. It's going to cost us to get some of that money back. And I think that we're in a position right now that we're going to go through recalibration. Maybe this is a discussion that we have through recalibration as we move forward. But to try to push this bill forward through right now, I think there's so many larger fish that we can fry. This is a very insignificant amount of money when you talk about the total school foundation account. I can't support this bill.
Thanks, Mr. Chairman. I have similar thoughts. This is easily and unquestionably the best version of this bill we've looked at in the 13 or 14 years that I've been talking about it. So I appreciate all the work that went into it, but at the end of the day, I'm still not compelled that we end up with better special education for our students. We just end up with what has become a greatly improved and yet still bureaucratic approach to finding some additional money from the feds to diminish our costs, and to hear concerns that it still will end up reducing the amount of time that our providers spend with kids is the disconcerting part. If this were saving $100 million when we did this, then this is a great solution, because really I do appreciate the work that just went into it and the thoughtfulness on diminishing the bureaucracy of the billing. Great work went into this, so thank you to everyone that's been spending time on it. But we're talking about a net $2.3 million. I still, and that's for the 9 biggest districts again. I still have the concerns that I've had for a long time. I want to make sure that what we're doing is in the best interest of the students, not in the best interests of the state just looking for ways to chip away at the budget.
Thanks, Mr. Chairman. And I am going to vote no on this bill, but I do appreciate the health department and what they've done. Appreciate the Department of Ed and what they've done. And I'm going to go back to previous legislatures and what they have said over the years. And we are an awesome state because we take care of our most vulnerable citizens. And it really helps. And there is no one, and I've been a special ed teacher for 25 years, and thank you for showing up today. And I get it. And government is not involved in the IEP process. It is a team of parents and teachers and professionals, and it takes a lot to diagnose someone with a disability. And just because you have a disability doesn't mean you get specialized services. Specialized education is what IEP is. Doesn't mean that. Okay? It takes a lot of work and a lot of people, and it's a team. And I encourage those of you who want to go see the process. It's long. It's very long, those initial meetings. But again, back to what previous legislators have said in this state. We are going to reimburse at 100%. We're going to take care of our most vulnerable citizens, and I'm so proud to be a part of that, just in the inner workings of that. It's just amazing. Even when we're down on staff, we still are out there giving it our all. And thank you for your comments today, because a lot of my colleagues feel the same way. And thank you for the department. There is streamlining. It's getting better. This is a really good bill, I thought, but I still think it's not quite there, because we're awesome in this state for providing for our most vulnerable citizens. Thank you.
Mr. Chairman, and I think that Representative Berger has put it well. The state is doing a good job by its special education kids. It's a product in part of the court decisions that we've dealt with, and we are approaching things a little different, and we can afford to approach things a little differently. The issue here, we are going to put additional burden on the people that are doing the special education. That burden is quantified at $500,000 a year, but it's a significant burden. We are going to get from the feds about 2.8 million in additional revenue for the state. Now, if things work out, I'll be interested to see when we get the January Craig report, because we may be, with the way the election turned out, we may be going to benefit from that if we expand production of minerals in the state. We may find the value of those minerals goes down, and we may be hurting because of that, or we may make out like a bandit because we'll do more drilling and more mineral production in the state. We don't really know at this point. So this is a possibility for getting more money out of the feds. It'll increase the size of government by $500,000. To get that, that's not something we want to do, but that's the nature of the Medicaid program. So you could go, on this bill, you could go either way. Say we need the additional money because we want to do things like give homeowners tax relief, but this is going to be relatively a drop in the bucket for that. So we could come down either way rationally on this bill. So, Mr. Chairman, that's what the issue is. Are you willing to expand government by $500,000 and put a burden, and that burden falls, that expansion falls on the people we're having trouble recruiting some because they're short in supply, that have to do this work, they'll have an additional burden because of the federal requirements. Is it really worth for the additional net 2.8 or net 2.1 million, net a total of about 2.8 million we're going to get out of the feds overdoing it? It's a rational decision either way. So.
Representative Lawley, please go ahead.
Thank you, Mr. Chairman. First of all, I really do appreciate the cooperation between the Department of Education and the Department of Health to work on a solution that is better than anything we've talked about during the interim as we've tried to work this. And I applaud you because you've done a great job. And my issue has always been about mandating, that we would mandate districts. I hope that there is room, maybe in budgets and with grants from the federal government, matching funds for the Department of Health to continue working on the streamlining process. I think that will encourage districts to voluntarily participate. And I would rather see that, but I think we wouldn't even be at that point if you hadn't done that good work. So I want to say appreciation for that, but my issue is mandating districts to do it. Thanks, Mr. Chairman.
Mr. Chairman, on 25 LSO 95 Medicaid and Child Health Insurance Program billing, Senator Beitman? Senator Brennan? Senator Rothfuss? Senator Steinmetz is excused. Representative Allred? Representative Andrew? Representative Berger?
No.
Representative Brown?
No.
Representative Clausen is excused. Representative Lawley?
No.
Representative Obermuller?
No.
Representative Provenza?
No.
Co-Chairman Scott? Chairman Northrup?
No.
You have 12 no and 2 excused.
Very good. All right, we will take a short break, and when we come back, we are going to take on item number 9, which 9's next, and that's the recommendation from the Mental Health Task Force. We're going to jump to item number 9, which is recommendations from the Mental Health and Vulnerable Adult Task Force. And with that, I'll turn it over to you guys. It's all yours.
Thank you, Mr. Chairman and members of the committee, and Chairman Northrup, Chairman Scott, thank you for bumping us up a little on your agenda, and apologize if that causes inconvenience to anybody. Somebody has to be at 3. We're just glad it wasn't us today. Mr. Chairman, if it's all right, this is a follow-up conversation that we had with you earlier in the year, where we talked about the inclusion of BAR and Project Aware, and we have since come back. Our assignment from you was to come back with the final bill on what we would recommend. And in light of that assignment and working with the Department of Education and the Mental Health Task Force, our recommendation has been that we'll pull BAR out of providing funding for statewide implementation. We've got, and the biggest reason for that is we have high hopes and we think that it's a great program, but we don't have the data to support it. We have some schools that have implemented that ahead of any funding. The idea was to find out how that is working and then have better data that would support then a request to further fund and implement that in other districts. And so what you'll see in this bill is a request to provide the districts, all districts, to implement the AWARE program. It's not a mandated thing. We're going to provide some funding and outline what that's for. But again, it's not going to be a requirement, and this will be for this biennium. We'll talk about how we do the funding. In this, we do some stuff to make, because we're in the second half of the first fiscal year of the biennium, and so we'll make some stuff effective immediately and then provide a supplemental a request for the second fiscal year of the biennium. We feel that that'll give us, again, enough data to support this moving forward. We're confident, and in this, we direct the Department of Education to have this request, the biennial request in their next standard budget request. We'll have the ability at that time to reevaluate the number of schools, the actual cost, and we can adjust that number if need be at that standard budget hearing. So with that little precursor, Mr. Chairman, I'd like to ask Ms. Johnson if she would go ahead and walk us through this bill, and then perhaps myself and Dustin can provide some comment and answer any questions we might have.
Sounds great. Go ahead, Ms. Johnson.
Thank you. Thank you, Mr. Chairman, members of the committee. Anna Johnson, LSO. This bill is entitled 25 LSO 363 K through 12 Mental Health Program. In section 1, starting on the bottom of page 1, this bill draft creates a program to address the mental health needs of K through 12 public school students. The program will be administered by the Department of Education, and this program is essentially the Project Aware program, and it's going to exist for a minimum of 2 school years. It's going to be available to every Wyoming public school district, each of which can choose whether or not to implement it. And then in subsection B on page 2, each participating school district is required to report to the Department of Education the expenditure of amounts appropriated under the Act, the number of students served, and the impact of services offered, as well as any other information required by the Department of Education. And then as a technical correction, as this bill draft goes through final legal review, if you decide to move it forward, we're going to be codifying section 1 as Wyoming Statute 2113-338, since this is going to be an ongoing expenditure. In section 2, beginning on the bottom of page 2, up to approximately $5.8 million is going to be reappropriated from the Public School Foundation Program account from the appropriation repealed in section 3 of this act. These funds are appropriated to fund Project Aware for the 2024-2025 school year, and then any unexpended, unobligated funds will revert on June 30th, 2026. There are going to be some technical corrections that need to be made on page 3, and we're just going to make those changes as the bill goes through final legal review if it goes forward. And then in subsection B on page 3, approximately $5.8 million are appropriated from the Public School Foundation program account to the Department of Education to implement Project Aware for the 2025-2026 school year. Any remaining amounts will revert on June 30th, 2026, and it's the intent of the legislature that the department double this appropriation and include it in their next budget request. In subsection C on page 4 from the appropriation in subsections A and B, community project manager positions will be created in each participating district. And then in subsection D on page 4, the department has authorized 2 full-time positions for the purpose of implementing and administering the act, the salaries and benefits of which are to be taken from the appropriations in subsections A and B in an amount not to exceed $225,000 per school year. It's the intent of the legislature that these positions be carried over for the immediately succeeding fiscal biennium. And then section 3 repeals section 331A of the 2024 budget bill, which appropriated $10 million for mental health programs for the K through 12 public school students. Section 4 requires the Department of Education to report to the Joint Education Committee findings and recommendations on the number of students served by this program, and shall include any recommendations to address the costs associated with responding to students' mental health needs. And then section 5 provides an immediate effective date, and I would stand for any questions.
Any committee member have a question for Ms. Johnson on the bill? Chairman Scott, please go ahead.
Mr. Chairman, this, as I understand this bill, it's going to put in something called Project Aware on a trial basis in a few districts to see what we get out of it and see if it works. And in the process, we're getting rid of a prior appropriation. And is that right? I'm confused.
Representative Larson, would you please expound on that and then also bring this up to what Project Aware will be so that people
Yes.
are kind of brought up to speed?
So, Mr. Chairman, thank you, and I will. And if I may, on describing the Project Aware, I'm going to leave the more detailed explanation of that to Mr. Brown, but come back to the work of the task force was in how to address the mental health issues that we're seeing in the K-12 system. And as we discussed previously, the dilemma is do we turn our schools into mental health providers, or do we somehow navigate and manage the population that have mental health challenges to facilitate or coordinate them having access to mental health services? The task force has come back to this committee and are recommending that we would strongly encourage us to avoid turning our schools into mental health providers, and to really be able to equip the schools with the ability to screen or identify those people who are having mental health challenges or behaviors, to be able to stabilize or to control a situation in the event that there's an outburst. I don't know the right word to use on that, but to make sure that student and other students are safe, and then to refer for services. And so know where these services are available, and then to coordinate with the family what the situation is, and allow the family, of course, to make the decision on what services they want to engage in, if any. A greater conversation then was, so if you have a family that says, okay, but we just don't have the money, how do we do this? To have the ability to refer them to programs through the Department of Health, through the Department of Family Services, through the behavioral health redesign, to make this available, but we're trying to maintain that policy of what the state's role is in providing mental health services to the public as a whole. And we are really feel very strongly that there is no intent here at all to supersede or skirt around the family's role to make a decision with this child in school, and we know that there's some variance there. So we'll get into more on how this works. Now, Senator Scott, Mr. Chairman, if I may, Senator Scott, we've actually already, the Department of Education's already done pilot programs with AWARE, I think 6 or 9, 14 districts from the good guy on my right that have already implemented AWARE over the last couple of years and have seen the successes and where we've needed to make tweaks. So what this bill does then, Senator Scott, is it provides enough funding that Project AWARE could be implemented statewide, but again, respecting the desires of the individual districts, it is not requiring it. And so it'll be a grant program, and that's what the funding is based on. So then when we come down to the funding on page 2 and on page 3, it's in 2 sections. The total biennial amount is 11.5 or 11.6 million. We're into the first year of this biennium. So what we've done to kind of offset when we have some funding available, as you'll recall in section 331 of the budget bill, we appropriated $10 million last year to use during this biennium for mental health purposes. There's about $5 million that the Department of Education is going to allocate, and then this bill takes $5 million of that $10 million to implement this, the first fiscal year of this biennium, which will be in the last 6 months of it. And we make that effective immediately. So what we do is we delete, in section 3, we delete that section 331 because $5 million is already obligated. The second $5 million will go here. Then we do in section, on page 3, then we appropriate the second $5.8 million for the second half of the biennium. Now, the fair question is, will all of that get used? That depends on the number of districts that elect to participate. Any leftover, of course, then per statute will then revert back to the school foundation program. But that's why we're making it effective immediately, so we can use that money first that we already have in place to get us through the remainder of this first fiscal year, then provides it for the second. And then, as I mentioned earlier, then it directs the Department of Education, after they've gathered that information, to include this in their standard budget for the biennial amount or adjusted per what we find out through this pilot. And I hope that that's answered those questions.
Mr. Chairman?
Go ahead, Mr. Chairman.
As I often do with Wyoming budgeting things, I sometimes feel like there's a shell game going on, and we're looking for how much is under the various shells. And I'm having a little trouble following.
Okay.
Is the net effect of this bill to take what's already been appropriated and use it slightly differently? Or is the net effect of this bill to add 5.8 million to what's already been appropriated? I'm trying to figure out, are we just repurposing something that we've already appropriated and defining it better, or are we adding something to it?
Mr. Chairman, Senator Scott, a little of both. Okay, and I'll explain that. So let's just assume that it's going to cost 11.6 million for a biennial amount, but we're already partway into the first fiscal years of that biennium. So when working with the Department of Education, we were trying to think the most fiscal prudent way to implement this in a supplemental year. And so of that 10 million that we appropriated for mental health use, we felt that it was appropriate to be able to use part of that to implement that in this first fiscal year. So that would be half of that 11.6. Then we appropriate the second, we request as the second fiscal year, the amount for that, the 5.8. But to your point, that total amount of 11.6 will be the request in their next standard budget. And I apologize if I'm not saying that well, Mr. Chairman. I'll try again if I need to.
Mr. Chairman.
Go ahead, Mr.
Let
Chairman.
me see if I'm understanding now. There will be, it was not when we appropriated in the budget last time, it was not contemplated that there would be an additional, that this was going to be an increase in the standard budget going forward. And so that piece is new here. Is the additional appropriation here, is that essentially reappropriating the stuff from last year, or is that growing the government by 5.8 million?
Go ahead.
Mr. Chairman, in section 337 of last year's budget bill, we appropriated $10 million to be used for school districts for mental health purposes. And it was really just that. It didn't contemplate implementing any new program at that time. The Mental Health Task Force, as we worked through this process and as we were trying to address the mental health needs in the K-12 system, we knew that we couldn't do that without some fiscal impact. We had two options. We could come in this supplemental year as we try and implement this bill to do an additional growth of expenditure by 11.6. Moving forward, in the next standard budget, that will be the increased cost for addressing mental health, is that'll be an increased cost to the K-12 model of 11.6. You'll remember last year there was a bill that wanted to do that by 125 million. So we're down. But for this second half of the biennium and the remaining first fiscal year, what we were trying to do was make that 11.6, do we have any of that are existing funds that we could use during this existing biennium? And so we're taking half of that 10 million that was in that budget bill and using it for that. Does that make more sense, Senator Scott, to you? And I apologize that I'm a poor explainer.
Mr. Chairman, it's not that, it's our budgeting system has gotten so complicated, Mr. Chairman, that it's difficult for those of us not in appropriations to understand exactly what we're doing here.
Well, Mr. Chairman, I confess guilty as charged. I just knew where some money was, and I was trying to not have the full impact in this biennium for this amount.
So, Mr. Chairman, what we're doing is we're adding, we've had 1 year of that expenditure that was in the budget. That's committed and done. What we're saying is we're going to carry that forward and change it a bit with this bill and take it to a 2-year program.
We will at the end of yes. We're going to ask for the second half of this biennium, and yes, moving forward, it would be for the full amount. You're right.
Okay. And Mr. Chairman, my question is, we've got there's a clear need for mental health services in the schools. And it's been that way for some time, and I think it's grown. Because we've had the society has got some problems that it didn't have a few years ago. Or or put it this way, they've gotten worse. If we were to say we need the bill, we need to take the money out of the existing appropriation for the coming fiscal year. But we could do without the appropriation going forward and say this is one of the items that's on the plate for the recalibration that's coming. Is that a rational strategy to approach this as opposed to saying, we're gonna continue this for a second year and appropriate 5.8 million additional?
So, Mr. Chairman, that really is a great conversation and one that we've had, because at the conclusion of our last legislative session, the question that Chairman Baldwin and I had for the Mental Health Task Force on this matter was, during the recalibration, what will the consultants take into consideration for funding K-12 within the model, within the basket of goods for mental health services? We've had some look at that, and my conclusion after visiting and contemplating that with the folks that I feel really can give us the best direction is that there really is not a clear model for providing mental health nationwide in the K-12 model. And based on that, we felt it was important to try and help establish a policy for what we think the K-12 system should be doing for mental health services, so that the consultant in recalibration will take that into consideration and help formulate a request based on what we have established as our policy. Now, the funding for this is outside the model, which we think is really important because it has to be used solely for this. Whereas if you put it in the basket of goods, right, then that changes how that can be disseminated, if you will, down or distributed down the line. So that's the reason we're making this request, is because it's outside the basket of goods and it's solely for this.
So the net effect of this is to say, if we pass the bill, this amount is going to be outside the model, so that school districts, you cannot use it for anything but the mental health.
Mr. Chairman, Chairman Scott, that's correct.
And we have seen school districts take things in the model and use them for other purposes at quite a scale. And the question is, are they improving the results or not by doing so? But that's a separate issue. Now, am I right in thinking, Mr. Chairman, that this 5.8 million, we're going to fund the remainder of this biennium by taking the appropriation that's already been made? And so this 5.8 million is for the first year of the next biennium?
Mr. Chairman, you're really close. You're spot on for this fiscal year, the first year of the biennium that we are currently in. We're taking it from a previous appropriation that was made. And the request is for the second fiscal year of our current biennium. There was not enough previously appropriated, Mr. Chairman, sorry. There was not enough previously appropriated in the current budget system to fund it for the full time period of this biennium. So we have to ask for some more.
The budget bill, last year, there was a biennial budget bill. It was appropriated 11 point some million. And that was just, is all for spending in the first year of the biennium, is that right?
Mr. Chairman and Chairman Scott, that 10 million in section 337 was for a 2-year period. The language of that section 337 is to establish a grant program based upon the school's average daily attendance for school year 24-25 and school year 25-26, so the 2 years. And they've allocated, they're in the process, they've obligated half of that already, so we couldn't use the entire 10 million for this. So we took the remainder, the 5 million that's unobligated, which was enough to get us through this first fiscal year. And that's why we're asking for the additional for the second fiscal year.
Go ahead. Senator, please go ahead.
Thank you, Mr. Chairman. Question on the Project Aware. If these districts take this money, do they have to implement Project Aware, or could they use it for whatever mental health services they wish to provide?
Mr. Chairman and Senator Beitman, on this bill, they have to implement Project Aware. Now, if I may, because we keep referring back to this section 337 and that 10 million, that first 5 million that's in there, they can apply for and they can use it for whatever mental health program they want, and that was only for this biennium. But we're trying to establish this AWARE program statewide and provide the funding for that.
We were gonna have a quick discussion on what Project Aware was, and we kind of got off in the accounting world, so can you bring up and just to enlighten the public and us and make sure that everybody's on the same page.
Yeah, Mr. Chairman, committee, thank you for your time. Dustin Brown with the Wyoming Department of Education. Project Aware is built, we built it back in 2020 with our first grant opportunity for school-based mental health. What we've done is we've taken a collaborative approach with our students, our parents, our families. And when the services are appropriate for the family and the student, what we do is we recognize a referral model, and that referral model is based on a framework of 3 items: prevention, recognition, and referral. This goes back to our construct where we want educators to be educators and we want healthcare providers to be healthcare providers. So what we do is we bridge the gap between education and healthcare and get the students the necessary services for things like what we've seen with AWARE is we're helping support student needs with anxiety, depression, PTSD, operational defiant disorder. Those are the depression. Those are kind of our top 5 areas that we're really helping students with Project Aware on. The way we've measured success with Project Aware is we look at what's called functional data. How am I doing in comparison to my relationship with my peers? How am I doing in relationship with my family? What we've seen in that time is we've gone from the 30th and 40th percentile for those students up to the 80th and 90th percentile for those students. So where I'm going with that is functionally we know AWARE is working, and that the utilization of the Project Aware model is receiving desirable results within our student population. It all falls back to, is this the right choice for the family? And if it is the right choice for the family, we utilize our community project managers, which this bill identifies that there would be a community project manager hired for a district. And then that community project manager works specifically to build those bridges with our community-based healthcare providers, whether that's the community mental health centers, whether that's private industry, whether that's, you know, an individual provider, social worker, a social worker, LPC, things like that, to actually deliver those services to the students. And then we also have a flexible approach to that where we really try to make the time work on the family's time for those services. So if after school works for that family, we try to support that. If during the school hours works for that family, we try to support that. So we try to be very agile and flexible in how we implement Project Aware, trying to serve the needs of both education and healthcare through this model. And with that, I can stand for any questions.
There we go. So my question is, if a district already has a system in place, do they have to use Project Aware? Do they have to, in order to get the money, do they have to go into Project Aware? Can they use the money for what they have in place?
Yeah, Mr. Chairman, the bill itself does require Project Aware, but Project Aware actually supplements really well existing systems. It was built off the multi-tiered system of support framework, so no district is really starting from scratch for the most part in Wyoming. Project Aware kind of comes in as, you know, the other half of the effort and supplement those existing systems. So while we're calling it Project Aware, it's largely already going to be supplementary and ancillary to the efforts that are already occurring within the district.
Well, I guess, yes, that's what I'm asking you. Districts can go ahead and use money to supplement the programs that they've already picked up. The program before was less of kind of explore and use the money, use that Health Grant money for programs that might fit like a district in particular.
Yes, I think the biggest difference between the $10 million allocation from the session and this is really that community project manager and building those bridges with the external partnerships. There's no the $10 million allocation was non-specific, so we've really taken an approach that we can look at programming, we can look at direct care services with that, we can look at curriculum. There's a lot of different things that districts could feasibly do with that $10 million allocation. Project Aware is a little bit more specific with that community project manager role and that direct services. So for example, there's an MTS item called Hope Squads, and essentially these are peer support kind of structured activities that occur. This bill wouldn't necessarily fit into that kind of mold where we have some of those ancillary efforts occurring. This would be more designed for going back to those three frameworks of prevention, recognition, and referral.
Further questions from the committee? Go ahead, Representative Lawley.
Thank you, Mr. Chairman. Again, under Project Aware, I just want to be sure we're really clear on this, that every step of the way, the parents are a part of the decision-making process, and ultimately the parent decides what will be done. Is that correct?
Mr. Chairman, Representative, that's absolutely correct. The process starts with parental consent just to refer to the external provider. And then once we go to the external provider, that consent is confirmed a second time to identify that it is the right choice. So we've got the parent involved in both those locations, and then the discussion on the treatment plan portion. Likely, it will include parents, but it could also include parents from a direct services perspective where family counseling is potentially one of those items in the treatment plan. So yes to your question, multiple times throughout the process, parental consent and parental involvement is worked through each step of the way. Yes, ma'am.
Further questions? Further questions? We'll go to public comment. Thank you.
Thank you for your time.
Public comment. Anybody have a wish to comment on the bill? Anybody at all? Anybody at all? Going once? Going twice? All right, we'll close public comment. Committee, what's your pleasure on the bill?
Move the bill.
Moved and seconded. Moved by, I'm sorry, I'll do that correctly.
I should have let.
Moved by Representative Berger, seconded by Representative Provenza.
You got parental consent involved, you're not gonna do the mental health treatment in the school district, it's gonna go outside for professionals. Am I missing something? I don't see that language in the bill. Where's that requirement?
Mr. Chairman, can
Did I
you
miss something?
state the question again?
Yeah, could you please state your question again,
Okay.
please?
Where in the bill is the requirement that for the parental consent and the requirement for going outside? I don't see it.
Mr. Chairman, I don't see a requirement for parental consent, and it would note, I know there was a lot of discussion about the Project Aware and whether that was the required initiative, but that term does not appear in the bill draft, Project Aware. And so if it is the committee's desire to have districts use only that, I think you do need to amend that into the bill draft. Anna, his question was basically, where in the bill draft does it require parental consent? Where in the bill draft does it require parental consent?
Go ahead, Representative Larson.
Last things first, it doesn't say in the bill parental consent. That's in the design of Project Aware.
Program.
Okay, so it's not in the bill. As far the intent of the Mental Health Vulnerable Adult Task Force was to implement Project Aware. We thought the language of this bill was sufficient enough to do that, and you'll recall the conversation in the last meeting when we talked about BAR. Well, BAR is one of a number of commercial, if you will, programs available to school districts. And we've avoided AWARE, but AWARE is not. AWARE is just an acronym that was created by the department. So it would be the intent that we include that term in the bill, amend to do that, unless this committee wants to amend that and just make that those, because as written, and I think Ms. Heitrick is correct, it is not specific enough to say that it has to be for Project Aware.
Go ahead, Representative.
Mr. Chairman, I guess I respect where your hard work has come from. I also respect what the chairman is trying to get to is, what if the Project Aware situation at hand, we'll call them the rules or however it's built into it with the parental consent changes. I feel like there's this overdrawing drive right now to have parental consent in pretty much anything and everything. And I think that that's the fear that maybe a few of us might have of, do we need to explicitly lay that out in statute without needing to go down and say, well, we hope that Project Aware continues with that parental consent?
Mr. Chairman. I would share with you that those concerns on parental consent are the same ones that the conversation that we had with the task force, and then as we worked through this with the Department of Health, Department of Family Services, and the Department of Education. It was that, so what if a school identifies this child needing care and they identify the family and, or talk to the family and the family says no, right? Then no, it is, right? Or what if there isn't funding? You know, what does the family not have a responsibility in this whole process? And we felt that indeed they do. I don't think if it suits this committee and that it makes it clear to identify that parental choice or parental decision maybe even is essential, that doesn't dilute the intent of this bill one iota from what we had perceived or had hoped it would do.
Thank you, Mr. Chairman. I indeed believe the bill needs to include that clarity because, again, I think right now we all have that clarity. I think that certainly is, I accept the department's intent, but I think it's important as we talk about referring students, I'm on page 2, lines 1 through 8, that we could easily, I think, amend and make it and clarify that all of those things would happen with parental involvement and consent. But I do believe it needs to be in the bill. I would just also offer, Mr. Chairman, that I do believe that we need to say that the intent is that the department operate project aware. I think you guys understand that you had a lot of conversations, but which I have no objection to particularly, but I think it should be in the bill that we reference the particular program that we're funding, especially because it was said earlier that we don't really see this funding going to anything else other than that. So I think that clarity would be helpful for the public. And so that's just my view on it. Well, it is on parental consent, certainly a conceptual amendment. And I haven't looked yet where in the bill maybe when it says the program on line 8 on page 2, and it's where we identified the program, but there may be an earlier place. So I don't.
Please go ahead.
Mr. Chairman, Representative Lawley, it could go on page 2, line 2.
Yes.
Okay.
And then the conceptual amendment could also go somewhere in lines 1 through 8 there.
Yeah.
Regarding parental consent.
Do you get it? Do you understand?
Mr. Chairman, I think I'm getting an understanding. It seems to me as the bill is before us right now, what it really is just an increase in the appropriation. And why that should be done as a bill as opposed to an amendment to the budget, I'm not quite clear. I am nervous in this area about a conceptual amendment. I kind of want to see the language explicitly. And if we don't have that, then maybe it ought to be a private bill. And maybe it is intended to be a private bill.
Representative Lawley first, then we'll come to Senator Rothfuss.
Thank you, Mr. Chairman. I kind of agree with that. We should see the language before we just vote on a conceptual amendment. And I think what I would suggest is that we take a little time and maybe after lunch, I know that might have been a timing issue here, but that we get something drafted by LSO that we could look at. And if we want to proceed.
Okay.
And have it by right after lunch.
Senator Rothfuss, do you have a comment?
Yeah, Mr. Chairman, two things. The first is with regard to the appropriation. It's actually my understanding that this is not an increased appropriation. This is redirecting a prior appropriation from 321A of the budget bill. And that while that was very broad in its language with regard to K-12 student mental health programs, This provides more specificity on how the remainder of those unused funds would be spent. So I don't believe there is an increase in appropriation here. I believe it is a reuse of that appropriation, and that is for this biennium. Now, if the program were to continue thereafter, that would require potentially an additional appropriation or to be budgeted in the future, is my understanding. And I see Representative Larson wants to weigh in on that, so I'll pause for my second question and wait for that.
So if you take a biennial amount of 11.6, in this biennium, we're only going to increase the budget by 5.8 because we're going to use the other 5.8 from an existing appropriation. So there would be an increase in this biennium of 5.8. The next standard budget request would be for 11.6. Now, Mr. Chairman, if I may, to Chairman Scott's point of questioning why this would not be in the budget bill is because it changes the green books, and there's this fine line, and we always get our hind end in our ringer when we legislate in the budget bill. And so because we'll be changing the statutes as we noted in section 1, then it really needs to be in a bill with an appropriation. Now, moving forward, it will be a budget process once we establish the program.
Representative Obermiller.
Thank you, Mr. Chairman. Can you describe for us the landscape of providers or anticipated providers? Who is out there that actually is there to take these students and provide these services around the state? Or is this one of those, if we build it, they will come kind of ideas?
Representative Larson.
Representative Overmuller, as we have visited in this conversation with mental health providers, meaning community mental health providers, private providers, telehealth providers, it's an all-in. And and that's on all mental health issues, but that's the importance of this AWARE program, is then we've got this coordinator in the district that can help find services that are available, whether you be in Farson, and what's available there, or if you're in Cheyenne, where you may have reasonable resources available. And so that coordinator position is really critical because there are not an overabundance of mental health providers in the state of Wyoming or nationwide. And Mr. Chairman, I would add that was, kind of last year, we come out and we says, well, we just need to throw some money in the schools, in the basket of goods, and they hire more counselors. That's what we need to do. Well, that's fine. Where are you going to get them? There's a real challenge there, statewide and nationwide, in finding these counselors. And so then, and I think you'll see that addressed you'll see that addressed in recalibration. Do we increase the number of counselors based on the population that we currently have in statute for, and so most districts have one counselor and within the district, and with the capacity, with the ability statutorily and within the model to have other counselors, but I think you'll see that addressed in recalibration more.
Thank you, Mr. Chairman. So are you saying that we'll have in-school counselors and out-of-school counselors, kind of the whole basket of potential solutions to this? And as part of that question, what went into the thinking of taking it outside the school? Why was that an issue in the deliberation of this?
Mr. Chairman, if I could ask you, Representative Obermuller, to ask that second question again, please.
Mr. Chairman, the second question is the decision to take the counseling outside of the school system to private providers. What led to that rather than just building up the structure within the school?
Mr. Chairman, we're trying to help establish the policy of what the state's role is in providing mental health services within the K-12 model. So should our school districts be equipped to provide the full scope of mental health services for their students within the school system? The task force says no. That is not the role of education. We've identified the need for additional counselors in the K-12 model, but when we look for referring, you're referring out to a professional and a professional services that are generally maintained in the community. I think the addition to counseling, licensed clinical social workers or psychologists within the model would be to stabilize and control those needs within the school district, but not to be the ongoing monitoring in correction or overall helping of long-term help for that individual. That should be outside the school system.
Okay, I'm gonna drag us back into the amendment that's been laying on the floor for a little while. And we've had enough time to think about where to put the proper language in it. So I'm gonna go back to Representative Lawley and see if, since it's your amendment, see if you have a place.
Thank you, Mr. Chairman. I think concerning the parental rights, probably one place to put it is after on line 5, page 2, line 5, the value of referring students for appropriate services with full parental involvement and written consent, or something like that. That's why I say there may be other places it's good to put it, but right now on the fly, that we make it clear referring students. Maybe even up.
I think that if you got it tied down one spot in the bill, that if we will permit LSO to the latitude to put it in other spots, go ahead, Ms. Johnson.
Mr. Chairman, Representative Lawley, most of the bill just talks about appropriations and things like that. I think you only really need to state it once, and I think it's sufficient.
Yeah.
Great.
Yeah, just in response to that, Mr. Chairman, we have a list here that says the program shall identify, refer students in need, health treatment, and recognize the value of referring for appropriate services. So it's those last two things on that list that I believe need parental involvement and written consent. So that's where I'm struggling a little bit with the best way to do that, just actually grammatically. So help with that, because I think this is probably where that should be. But on parental consent, on the other, I think you mentioned line 2 possibly on page 2, or line 3 for the issue of the AWARE program. But
right. I think what I'll do is say that school districts shall implement Project AWARE and get rid of the rest of the language after school years and on line 1 all the way through line 3.
Just
okay, I see.
Just set. That's.
Mr. Chairman, for clarification, just, you're saying you start at the bottom of page 1, line 13, where it says the program?
Sorry, actually, I think maybe on page 1, there is to be implemented Project AWARE to address the mental health needs of K through 12 public school students. So line 11 on page 1.
Yep. That would work, I think.
Yeah.
Chairman Scott, please go ahead.
I was going to suggest if, to Representative Lawley, if you went in on page 2, line 6, and just put a new sentence in, saying any referrals shall be made only with written parental consent, would that deal with that part of the problem adequately?
This is why we should just let LSO do it.
Yeah.
Representative Brown, please go ahead.
Mr. Chairman, I appreciate what we're trying to do here, but in my opinion, I think what we're trying to do on the fly is probably not the best way to handle this. What I would suggest, and this is my personal recommendation, is if we want to maybe displace this bill, set it on the table and have something happen during lunch hour or something like that to draft official language, and/or move this bill forward as is and work on an amendment as we go forward. But trying to squeeze this in as we're going on the fly is, I think it's more dangerous than it is doing good to the bill. I think we need to make sure that we're doing this right and not just trying to come up with this. And I heard the discussion of being a little afraid or a little concerned that, doing amendments and allowing the latitude for LSO to get those conceptual amendments in. That speaks to me as well. So at this point, I figure what we're trying to do on the fly is not working. So I would say either postpone this bill and have that as a motion or something along those lines, or we move this bill forward, see if it passes as it is, and bring amendments when we get to the session.
We don't have to worry right now about is the amendment outside the scope of the bill that's proposed, but if we come forward with a bill that's just an appropriation and try to put a parental consent amendment in it, I think we might have an argument on the floor. I would want to put at least something in here before I can vote for the bill.
Representative Provenza, please go ahead.
Thank you, Mr. Chairman. I mean, I think honestly, all this discussion is not necessary because we heard in testimony that the AWARE program requires consent. So if we're gonna pass a bill to support the AWARE program, we're gonna support them, and we've already supported them. We've already allotted funds, and now we're gonna come back and say, let's have consent to get consent to get consent. I mean, we passed multiple pieces of legislation that required consent in this specific area. Do we not trust that we did the work beforehand? So if we want to support the AWARE program, which I think we should move forward with the bill. And if something, comes out of left field between now and then, fine, have discussion then. But I think we would probably go to the AWARE program and see exactly that they have consent. And I think we can read the state statutes that we implemented in the last session that this committee worked hard on. And we can say, golly gee, looks like we've got a lot of consent going on around here. So that's my recommendation to this committee.
Representative Lawley, please go ahead.
Thank you, Mr. Chairman. In response to that, I don't think adding a few phrases is going to multiply the cost. We're not going to have any additional pages in the Green Book. And here's the truth. Parents have experienced programs in education that started one way and ended up another way. So I think that would be my concern, is I have no doubt that right now that's the way that program works, but I think it's a matter of assurance to parents that whatever we're doing in the area of mental health, that we are acknowledging their proper place to decide and direct those issues concerning their children. So I think it's worth a few words to do that, and that's just my response to that. But I do have a motion, I believe, on the floor.
Senator Rothfuss, please go ahead.
Yeah, on the motion, and I do appreciate the concern with not having the specific language that's been raised by a number, but getting to Representative Provenza's point, there was a substantial piece of legislation that came from this committee last year that addresses exactly this issue, and I guess I don't understand where that legislation fell short on requiring parental consent and written information. I just don't see why we need to add it to everything we do from this point forward as a committee. I didn't even like that bill, but it sure seems to directly address exactly this point. And if it didn't address exactly this point, what did we do with that bill?
Okay, so There's an amendment on the floor. I'm going to ask Representative Lawley to restate the language she would like to have in it, and if it doesn't get a second, then it will die.
Thank you, Mr. Chairman. I am recommending an amendment to add the parental involvement and written consent concerning any referrals on page 2, somewhere in the, again, lines 4 through 5. Again, I think I like Senator Scott's suggestion that we just put an entire sentence there. And then regarding the AWARE program, that I think page 1, line, either line 13 to what says the program, to put the AWARE program, or perhaps restate lines 11 through 13 to include the AWARE program. So those are my 2 amendments where we identify the AWARE program specifically, and that we make it clear that as we are stepping out with specific money for a specific program concerning mental health of kids, that we assure parents that we understand that they will be involved and provide consent every step of the way.
Looking for a second. It's been seconded. Okay, discussion.
Mr. Chairman,
Go ahead, Mr. Chairman.
with regard to part of the amendment on the AWARE program, Mr. Chairman, is my understanding correct that AWARE is not based on any specific statutory language? It's something that the Department of Education has developed on its own and didn't need specific statutory reference for. Is that right?
Mr. Chairman, Senator Scott, the AWARE program was built originally from a federal grant opportunity, but it's all entirely made from Wyoming and Wyoming personnel, so personnel with the Wyoming Department of Education.
I was just going to divide the amendment.
Okay.
And I'll weigh in then. Mr. Chairman, I know that we wanted to specify AWARE, but we don't have enough context within statute to know what AWARE is, which is why it's structured this way. I do agree with the intent. It would be nice if we could call that out, but I don't think it works, honestly, to say AWARE at this point as a part of statute where it's not called out elsewhere in statute unless we added some sort of definitional context. So I'd resist that portion of the amendment. And again, if this moves forward, starts going into session, there would be plenty of opportunity to try and clarify that, work it out, and make it more specific if we chose to. But at this point, calling it out in statute doesn't seem appropriate.
Senator Rothfuss, it's been our desire to quit naming things in statute, such as ACT and SAT, and so I have to agree, let's not name a program. Well, you're right.
Yes.
Sorry.
Yeah.
Representative Lawley, please go ahead.
Again, I don't have a huge heartburn either way, except that it is confusing when you read this. What is the legislative intent? And that could lead to issues. When the intent brought by the committee that brought it is that to use a specific program and every district use a program, but we don't say it here. I don't know where else we say it. And that was my reason for bringing it, is that it is confusing what a district could use this for, like literally. So that would be my response. So, and I do have now places with the help of our great LSO of exactly to change all the places, Project Aware, et cetera, if that part of the amendment passes, so.
All right. Any discussion? None appearing. We're going to proceed to vote on the verbiage, AWARE. All those in favor of leaving it in, please say aye.
Aye.
Adding it in, yes, adding it in is right. All those opposed? No. I say it fails. Okay. Now we're on Division 2, which is the language of the parental consent.
Would you like me to read what?
Yes, I think you should read your parental consent and where it goes.
Yes, thank you, Mr. Chairman. So basically on page 2, line 5, at the end, right after the or the period after the word services, say written parental consent shall be required prior to the referral of any student. Period.
Discussion?
Mr. Chairman,
Go ahead, Chairman Scott.
on and for this, I think this is consistent with what we've done before. I think it puts it in the bill where we can look at it. We may, during session, there is language that deals with the case where you've got a custodian that's not a parent. That may be a refinement, but if we put it in now, we can make that a refinement during session.
Are we putting this in because we think that districts that are, who are using Project Aware are not getting parental consent? Because okay. We're just making sure, for sure, right?
Yeah.
Okay.
We're hitting the nail
All
on the
right.
head
I'm
one
all
at a
right.
time.
Mr. Chairman, and one of the reasons for doing that is the prior, as I remember, what we've done in the prior thing has dealt mostly with the medical type of situation. And you can get an argument that this is outside of that, so we're just being consistent.
Senator Office?
Thanks, Mr. Chairman. I think the previous bill was very much focused on mental health, but regardless, I don't want to rehash all of that discussion, but I'm going to oppose this amendment for the same reason I opposed that last bill, which is the idea that there are no circumstances where a young adult doesn't have autonomy over their own thoughts. A lot of our parent choice discussion isn't taking power away from the school, it's actually taking power away from the child. I think we do too much of that. And I understand this is a very popular and politically supported approach to always add parents' choice to everything, parents' choice. But at the end of the day, we need to be thoughtful about the occasional circumstance where you have a young adult who is in need of services, and maybe their parents aren't going to be there to fill the form out. Maybe their parents are the problem in the first place. We've been neglecting that through this conversation for years. I just want to once again note that, oppose that change. Thank you.
Representative Provenza.
Thank you, Mr. Chairman. Yeah, I'm recalling an article that came out a few weeks ago of a case in Idaho where a young woman was pregnant and needed emergency services, and because of the parental consent requirement on being able to treat her, they weren't able to because their parents were not involved at all. And so I think you might be well-intentioned, but I think talking about these 16-year-olds who are at high risk of suicide in comparison to other groups, the other thing is we're referring these kids out. And so for many of these kids that aren't going to be able to drive themselves, their parents are going to have to be involved in getting them to that care anyway. And I'm inclined to trust the program that hasn't been sued yet, we're not hearing any concerns from parents or teachers that it's not working. In fact, we're bringing this legislation because it is working. And so it might bring unintended consequences that I think we should be concerned about. So I'll be voting no on this amendment.
Thanks, Mr. Chairman. And, when I look at Project Aware on the Department of Ed website and the vision and the mission and the primary goals and what we do in our district with Project Aware, I just don't see a need for this amendment because we are always involving the parents, and Project Aware is an evidence-based program for leadership through districts and the child and the parents and everybody involved to help kids access or help these families access mental health services that aren't being really, that people don't know about. That's all. It's just, and it's going great and we love it. And we were one of the first districts to go after Project Aware. I know that in Wyoming, especially when the federal grant came out and we saw a need for it. It's been amazing. And there just hasn't been anything that has really hindered us. And I just don't think it needs to be there. So, and reiterated. So anyways, thanks to the department for being, Department of Ed for having a very, very transparent vision and mission on Project Aware. Thanks.
Thank you, Mr. Chairman. Appreciate the comments, but I would simply end with this, that if it's not really needed and does no harm, why not assure parents that might have some concern about the movement of schools in a specific direction concerning mental health, to just give them that comfort? If you feel it's already there, what harm does it do to add it, to give the comfort to those parents that might have the concern? And again, I would just, again, ask for your support of the amendment.
In favor of the amendment, please say aye.
Aye.
All those opposed, please say no.
No.
All right, we'll have a show of hands. All those in favor, please raise your right hand, or a hand. Five. Okay. All those opposed? 6. It has failed. Okay, we're back on the bill. Is there any more amendments on the bill? Any more amendments on the bill? All right, we're gonna, yep. Please call the roll on 25 LSO 0363.
Mr. Chairman, on 25 LSO 363, K-12 Mental Health Program 2, Senator Beitman. Senator Brennan.
No.
Senator Rothfuss.
Aye.
Senator Steinmetz is excused. Representative Allred.
Aye.
Representative Andrew. No. Representative Berger.
Aye.
Representative Brown.
Aye.
Representative Clausen is excused. Representative Lawley.
No.
Representative Obermueller.
No.
Representative Provenza.
Aye.
Co-Chairman Scott.
No.
Chairman Northrop.
Aye.
I have 6 aye,
6 noes. Ties die.
5 no, 2 excused. Is that add up? No.
Yeah, could you restate that?
Sorry, Mr. Chairman, I struggle with counting sometimes. Six aye, 6 no, 2 excused.
Ties die. All right. Thank you for bringing it. We appreciate your work. Okay. Yes. Go ahead, Representative Provenza.
Thank you, Mr. Chairman. I just want to bring back to our attention that mental health for K through 12 has come up in the last 2 interims. It's been assigned to us this time because we failed to do anything worthwhile last time. And here we are again. So I just want to commend the committee on their great work for taking care of children's mental health.
We actually have because we have ran over a little bit, one of the people involved with the Imagination Library actually needs to have has another date at noon. So yeah, I need to move the Imagination Library up ahead of CTE again, if that's okay with CTE people. Thank you. So we are now going to go to item number 5 on the agenda, which is Imagination Library Program. Talise Hansen, Staff Attorney, LSO.
Mr. Chairman, members of the committee, Talise Hansen, Staff Attorney, LSO, presenting Bill Draft 25 LSO 229 version 0.6, Wyoming Imagination Library Program. This bill draft was requested at the committee's August meeting. I'll start by walking through the bill draft. Section 1 begins on page 1, line 10, by creating Wyoming Statute 212205, Wyoming Imagination Library Program. Subsection A on page 2, lines 1 through 26, provides definitions of county-based affiliate program, participating county, and registered eligible child. Page 2, lines 3 through 5, define county-based affiliate program as a local affiliate of the Wyoming Imagination Library Program that operates within a county. The staff comment on page 2 highlights that the committee may wish to consider whether to narrow the definition of county-based affiliate program or add requirements to be eligible to be a county-based affiliate program. As currently drafted, the definition of county-based affiliate program is broad and may include denominational institutions, corporations, libraries, school districts, and any other entity, business entity. Page 2, lines 20 and 21 define participating county as a county with not less than one county-based affiliate program. Page 2, lines 23 through 26 define registered eligible child as a child from birth to 5 years of age who resides in this state and who is registered in a county-based affiliate program. Subsection B on page 2, lines 28 and 29, and page 3, lines 1 through 4, create the Wyoming Imagination Library Program to be administered by the Department of Education. Subsection B also outlines the purpose of the program. Subsection C on page 3, lines 6 through 22, and page 4, lines 1 through 7, requires the Department of Education to coordinate with a nonprofit entity qualified under Section 501c3 of the Internal Revenue Code and organized solely to promote and encourage reading by children, to provide at least one age-appropriate book to each registered child in each participating county monthly at no cost to families. Also to provide the statewide development of county-based affiliate programs, advance and strengthen county-based affiliate programs to increase enrollment, develop a public awareness campaign to promote the program, administer the county-based affiliate program funding matching requirement, and solicit donations, gifts, and other funding to financially support county-based affiliate programs. Subsection D on page 4, lines 9 through 21, outline the funding matching requirement for each county-based affiliate program. Each county-based affiliate program is required to contribute 50% of the funds required for the program to operate in the county directly to the Department of Education. To the extent that funds are available in the Wyoming Imagination Library Program account, the Department of Education shall provide a matching amount from the account to each participating county-based affiliate program, not to exceed the amount of funds received from each participating county-based affiliate program. Subsection E on page 5, lines 1 through 11, creates the Wyoming Imagination Library account. Subsection F on page 5, lines 13 through 19, provides that the monies deposited into the account shall be continuously appropriated and expended by the Department of Education to administer the program and to provide the state's share of any matching funding available. Subsection G on page 5, lines 21 and 22, and page 6, lines 1 and 2, requires funds in the account to be invested by the state treasurer and the investment earnings to be credited to the account. Subsection H on page 6, lines 4 and 5, require the Department of Education to promulgate any rules necessary to carry out this section. Section 2 on page 6, lines 7 through 17, provides an appropriation from the general fund to the Wyoming Imagination Program account created in Section 1 of this act. The staff comment on page 6 highlights that the committee will need to determine the appropriation amount. Section 3 on page 7, line 1, provides an effective date of July 1st, 2025. And I'll stand for any questions.
Please. Chairman Scott, please go ahead.
Mr. Chairman, page 5, line 14, monies deposited shall be continuously appropriated. Is the implication of that we're going to make are we doing a one-time appropriation this time that will be there until it's exhausted, and then they'll have to come back for more appropriation? Or is this something that they're going to, this is, in the past where I've seen continuously appropriated language, it means that that the thing goes on forever and we don't look at the appropriation again. What's the implication of that language on page 5, line 14?
Northup, Chairman Scott. So the appropriation in section 2, if you appropriated money, would go into the Wyoming Imagination Library Program account. And then any money that is in that account would be continuously appropriated to the Department of Education for them to use. So when the money, they could use whatever money's in that account. It would be continuously appropriated to them. So you wouldn't have to continuously appropriate from the account to the Department of Education each time you were to add anything into that account. It would just automatically go to the Department of Education.
And Mr. Chairman and Chairman Scott, the appropriation does not revert as required under, statutes on page 6, line 13. Generally, there are reversions required under your appropriation statutes. Since the funds are not reverted, that's the reason for the continuing appropriation.
Yeah, Mr. Chairman. Staff comment on page 2, line 7 through 17. Is there a problem here with an appropriation in violation of Article 16, Section 6? Is that what's going on?
Mr. Chairman, Chairman Scott, that staff comment does address the legal memorandum that you guys were provided separately.
And cannot that be taken care of under page 6, line 4, where it says Department of Education shall promulgate rules? Cannot the rules just say that the money cannot go to denominational, like churches, for example?
Mr. Chairman, I believe that could be handled under rules, potentially.
Yeah. Mr. Chairman.
Go ahead.
Mr. Chairman, I'm concerned here. I don't know what kind of direction you got in detail on drafting this, but it seems to me that if there's a problem with, and we've encountered this all the time, it's a simple matter to appropriate to the Department of Education. And then they contract for specific services, in this case, providing a book to children, which is something I think that clearly we can do to improve the reading of this. And instead of having a staff comment, we should have had a bill that was drafted better. What am I missing here?
Mr. Chairman, Senator Scott, the bill draft is based on legislation from other states, model legislation. And if you recall, I think actually Representative Yin is online. He presented at your last meeting, and the instructions were to create a program that exists in other states based on their legislation. And so that is the direction that Ms. Hansen took in drafting this.
Okay.
Mr. Chairman, I hate to get into a public row with the LSO on something like this, but it does seem to me that we get a bill draft, comes from another state, has a provision that does violate potentially the Wyoming Constitution. We've got some pretty well understood ways of dealing with that work. We ought to either draft the bill so it doesn't have this, or we ought to have a specific suggested amendment to fix it, because they're not that hard to do.
Mr. Chairman?
Yeah, it's not their job, it's right, it's our job.
I'm honestly, I guess I'm not entirely following what the problem is. So can the chairman, Co-Chairman Scott, reiterate what his concerns are with this bill? It seems like it works perfectly to me.
And we really ought to make that legal memo we got public. But it seems like the problem is that the bill, what the bill draft ought to say, the money is appropriated to the Department of Education, which I think it does say. And then that they should contract with affiliates to do what is specified on page 3, lines 11 through 13. And maybe all we need to do is say the Department of Education, instead of shall coordinate with, say the Department of Education shall contract with to do these things. And then I think you've dealt with the section 16 it's Article 16, Section 6 of the Wyoming Constitution that says that we can't make these grants and aid. I think it's a very simple fix, and it should have been drafted that way rather than give us a staff comment.
Let me,
Go ahead, Senator.
I want to respond to that. First of all, you're the chairman of this committee.
Yeah.
If you have a problem with this legislation prior to the meeting, read it, bring the problem up, correct it prior to an education draft coming to the meeting.
It didn't.
That's my first thought. My second thought is with regard to the coordination, it's my understanding, and we can go to public testimony from Representative Yin and others, that we're not directly contracting. It's my understanding that they basically provide a nonprofit service and effectively at a very low rate end up providing these books, and that we have some responsibility through our counties to facilitate it if we have chapters setting up. So I don't think we're contracting with the third-party nonprofit organization. To my understanding, I believe we are coordinating. So I guess we might need a little more testimony for how this works from the public testimony that we have, whether that's Representative Yin or our other expert in the topic area that will provide public testimony. But again, if this is a concern, you know, why is this bill before us on the Education Committee when we know that these bills have been drafted for a little while? These are the concerns that you take care of before you get to committee. You don't raise them when we get to the committee meeting. I don't think there's a problem, but if anyone, you know, should be apologizing for this problem at this point in time, Mr. Co-Chairman, I think it would be our good co-chairman for not raising the concern prior to public comment. So I'm not particularly pleased with the critique of LSO. LSO does what chairman asked, and if you had a problem before this, raise it as we all do as chairman ahead of the ahead of this particular committee meeting.
And Mr. Chairman, I would point out, you brought it up, there is a legal memo on this. It does point out this issue. It is a policy decision for you all to make. You've disregarded our legal advice in the past. So, I mean, it's possible in this particular draft that this is a direction you'd like to take. And with that, if you'd like the memo to be public, you can certainly make a motion and we'll post it with the meeting material.
Mr. Chairman.
Go ahead, Mr. Chairman.
Mr. Chairman, I'm going to want to hear the public testimony. I think.
Chairman, can you move closer to the microphone so people
Okay.
can hear you this thing?
Mr. Chairman, I want to hear the public testimony. I think what the memo did, and I think we ought to make it public when we're done here. What it essentially did is I read it, was to say you've got a problem with the Wyoming Constitution, and I think the solution is to say contract instead of coordinate on page 3, line 6. But if that causes problems with the program, I want to know about it.
Mr. Chairman, I'll make the motion. I'll make the motion to just go ahead and make the legal memo public.
Been moved.
Second.
Seconded to make the legal.
Just a voice vote. Mr. Chairman, question on.
Public, all those in favor signify by saying aye.
Aye.
Aye. Opposed?
No.
Okay. We will make the legal opinion public.
Let's hear from you.
So let's hear from Mike Yen, is right. Let's hear.
It's not there yet, but it's in the meeting packet.
Representative Yen, would you like to weigh in?
Mr. Chairman, sure. I do want to give as much time to Ms. Briggs as possible, so I'll keep it short. Again, I went over this topic at the last meeting. With regards to drafting, I think I'm open to any amendments that Senator Scott would like to make on the topic. The state on the ground is that counties already have some county-based programs that do this. And so with counties that already do it and don't need funding, I think coordination makes sense. With counties that don't have it, it might make sense to contract with an entity to do that service. Ultimately, with regards to the legal memo, I think that this is something that prepares kids in Wyoming for the K through 12 system, and I think that is a public benefit for the entire state. So I have no concerns on the constitutional issue. If there's a concern there on the contractual basis with the types of entities, I think the amendment that the good chairman suggested could make sense. And with that, I'm gonna give as much time as possible to Ms. Briggs, and she can also talk about how it's implemented in other states that also have programs, but also have similar constitutional clauses like the ones that we have in the Wyoming Constitution. Thank you, Mr. Chairman.
Thank you, Representative. Could Ms. Nora Briggs come up and?
Mr. Chairman, she is online and she is joining the room as we speak.
All right, sounds great. Thank you.
Hello, good morning. Can you hear me okay?
Speak up a little bit more. It'd be great.
And let me adjust my volume.
There you go.
Thank you. I'm Nora Briggs. I'm the Executive Director of the Dollywood Foundation, which is Dolly Parton's nonprofit. Dolly sends her greetings, and she thanks you for considering expansion of her Imagination Library program across Wyoming. We agree nothing is more basic, more essential, more foundational to a child's success in life than the ability to read. The research in science is very clear. We cannot wait for kindergarten for children to have access and exposure to books and reading. We need to reach children early. Reading at this age happens primarily at home, and reading at home requires books. Not all families have access, nor can they provide books. This is where we can help. Dolly Parton's Imagination Library is a home book gifting program from children from birth to age 5. Parents opt in as early as birth. They receive the first book, which is The Little Engine That Could. It sets the tone for the program. I think I can. And it shares with parents how the books will arrive month over month with parent reading engagement tips. They graduate out of the program on their 5th birthday with a book called Look Out Kindergarten, Here I Come, which prepares them for their first time into the school. They can receive up to 60 books. Registered children receive an age-appropriate, down to the month of their birth, high-quality book with their name on it at their home monthly at no cost to the family. We have Braille books, audio, bilinguals, English, Spanish, with reading tips that help parents and increases the engagement and fun. Books in the home lead to increased kindergarten readiness. We've seen changes in the home literacy environment with families connected around these books and family members of all generations reading. Significantly stronger reading, math, and science and academic achievements in 3rd grade and beyond. Children who have participated in Dolly Parton's Imagination Library do better academically throughout the school year over non-participants. The program is special. Dolly calls this her heart program. It is about connecting hearts in a family, connecting them to each other, snuggling and cuddling together, and connecting hearts to books and to reading. And children will continue to do what they love to do. So let's help them love reading. Statewide programs have more impact and benefits than a collection of local programs scattered throughout your state. A statewide program has two primary goals. The first is to ensure access across the state. The second is to reach as many children under 5 as possible. Most states reach about 65 to 72% of their 0 to 5 population. Program is rolled out county by county, ensuring statewide coverage for all zip codes. Access for all families to educational and early learning resources. Children start kindergarten with a shared experience and helps level the playing field. It does create a shared bond among children from across neighborhoods, race, and economic differences. It really does help break the division. They've all received the same gift. The state program partners with state agencies to help find the most vulnerable and underrepresented children, such as those found in foster care or babies born to parents, whether they're youth or adults, in other systems or correctional facilities, and families that are receiving state benefits through WIC or SNAP. We partner with the state birthing hospitals, partner with the State Department of Education to flag participants and track program effectiveness. Ties to adult literacy, and if you have dual language programs, which places a multi-generational focus on literacy. The best way to learn to read is children's picture books. The best way to learn English, children's picture books. We can also do fun state level focus on family time and reading with Drive with Dolly license plate, campaigns around reading and literacy, and driving families to tie into the library. There's also opportunities that we've seen in other states where they layer on other family resource or other programs, such as partnering with Parks and Recreation to create storybook trails, using the Imagination Library to tie books, reading, and outdoor. A shared funding model creates a robust partnership between private and public dollars, and engagement is at ownership on multiple levels. This is not a donation program. It is a home book gifting program mailed to children across the state by the post office for children as soon as they're born until their 5th birthday. It is free to families, all income, all children under 5, no means testing. The Dollywood Foundation provides a turnkey program. We select the books, manufacture them, distribute them use a GDPR compliant database for privacy for children and parent data. We make it very simple. Parents opt in to register online through a website or a QR code. And in rural areas, we can also use paper form registrations. It is a community-based model. We partner with local nonprofits who promote the program, find and enroll children, fundraise, and pay a community share portion. This is not a subscription nor a membership. It is a gift. It would be a gift from the state of Wyoming, local communities, and Dolly Parton. Evidence-based, 30 years. We are working across 5 countries. We have gifted over 265 million free books. Since starting 30 years ago, we're now reaching 1 out of every 7 0 to 5 child in the U.S. with a goal to reach 1 out of every 4. We have over 2,400 local partners across the U.S., 21 state partners, mailing books to 3.2 million children every year. The setup and the structure of a statewide Imagination Library program is very straightforward. Is it intended to be easy to establish and implement? And the Dollywood Foundation is your partner. What we are looking for is a state commitment with a long-term vision so that children born in the state of Wyoming are born, they get books, and they get a book every month until they turn 5. It's why we ask for legislation to establish an Imagination Library with a yearly appropriation. We recommend a 50% dollar match to the local community cost to ensure that shared funding model and ensures that private and public partnership and continued community ownership and engagement. The Dollywood Foundation provides partnership and guidance, and we also offer a turnkey model, which makes it easy for you to implement. The impacts are significant. Starts in the home with families connecting around a book, family members reading together, increased multiple reading many times a day, sometimes many times a week, And it creates the tool. The book is the magical tool that comes into the home through the mail to create an opportunity for parents and children to have snuggle time, but it sets the foundation for parental involvement in the child's learning and development. The results are seen when they come to school. They're better prepared for kindergarten. They academically perform better. We have higher graduation rates. Reduced retention saves the state money. Reduced remedial reading focuses the dollars where they need to be and saves the state money. And the investment now upfront protects your K through 12 state investment per student. Educated workforce preparing for the future, with a community focused on books and reading, connecting into family resources. And we do know that families that snuggle and read and talk and sing and play together, the book is the tool, have a better chance at family life stability, emotional well-being, with the ability to have words and language to reduce negative situations and create opportunity for better mental health. And more importantly, puts children on the equal footing right from the start. So I will close. Dolly says thank you for joining in her dream that all children grow up in a home full of books. We know that simply getting books into the home changes the trajectory of children, families, and communities. We do agree that education is the equalizer and sets the stage for life. Thank you for your consideration. And Dolly wants to help create a love for books and reading and make sure that every Wyoming child has access to books and learning and be provided the start they need in education and in life. Thank you. And I'd love to answer any questions you might have.
Questions for Nora? And thank you for your presentation.
Thank you.
Anybody got a question? There's a question for Representative Yin. Go ahead, Representative Lawley.
Thank you, Mr. Chairman. Representative Yin, we have on page 6, line 7, the appropriation that's blank. Do you have any information about maybe the number of children in Wyoming that would be eligible for this program and what it would cost us to operate it? Because, I mean, I have no idea. So do you have thoughts on that?
Go ahead, Representative Yin. You're muted.
Mr. Chairman, thank you. I think Nora may have the answer to that, actually.
Nora, do you have an idea? Please go ahead.
I do have an idea. So according to the American census data, the American Community Survey, you have roughly 32,789 0 to 5 children in the state. It would be a book a month. Are you looking for a yearly amount or for 2 years?
I think we could do the math. If you want to do a yearly number, we can probably do that, or either way is fine.
Well, year one would be slightly less than a regular traditional year because you're ramping up to reach a certain number of children. Right now, we're reaching about 22% across the state. And the goal would be in year one to ramp up to 45%, and then year two, reach that 65-70% of children. Year one is approximately $300,000, and year two is $420,000. And that provides a book a month delivered at home for each child and provides a turnkey option for the state, for a state team member to run that with a dedicated focus to help with those local communities and finding the community partners and ensuring that the communities have their 50% fundraising and their dollar match.
Scott.
The goal of 45% year one, is that reached partly in an understanding that there are a number of existing programs out there, privately funded local programs? I know there's one in our community that I think is broader than our community that is doing exactly the same kind of thing. Are you taking that into account in getting to your 45%?
Yes, sir. We start at 22% and grow to 45. And with a 50% dollar match, we immediately ask our local program partners to find twice as many children. It's not meant to supplant what they're doing in the community with their own fundraising. It is meant to reach out to increase the amount of children that are able to come in. A statewide program is intended to have access for every child. So a parent puts in their zip code across the state of Wyoming. There's no waiting list. There's no limit to the amount of children that they can come in, register, and receive a book a few weeks later.
Go ahead, Senator Rothfuss.
And just for clarification, were those numbers, the 300,000 and the 420,000, was that the entire program cost, or was that what we should be contemplating as the state share of the cost as we're looking at the appropriation?
A very good question. That is the state's share. Thank you.
Further questions? Further questions from the committee? Go ahead, Senator Biden.
That's okay. Thank you, Mr. Chairman. A couple questions, I guess. Number one, why do we need a government program to give out books to kids? If somebody is feeling generous and wants to start a program and it sounds like a good one, why not just do it and not get the government involved? I guess that's question number one. And question number two would be, somebody mentioned that they will select the books, and so I assume that there'll be no oversight from the legislature or the state or the local communities as to what books will be sent out, but they'll be using state funds to do that. Am I correct?
Thank you for the question. It's, again, a very good question. This is meant to be a community-based model where it's a public and private partnership. So in the terms of the entire cost structure, Dolly Parton, her nonprofit, is funded by her businesses with a portion of her business revenues going to the Dollywood Foundation. So she is providing the books in the program, and there's a small at-cost community cost, like a community share. And it's that community share that we would ask the state, if they want to ensure that every child has accessibility to the state, that they could match that. We have found that to be kind of the most, the equalizing piece, where certainly right now we have programs that operate in local communities. They could be as small as one zip code or a collection of zip codes, but certainly not across the state. And what typically happens is there's a certain limit to what they can fundraise, and they can't sustain having children come in. So we find that we have children on waiting lists. We have children that live in some communities that have accessibility to these books and not at the others. And the idea is to ensure that there's accessibility at scale. The impacts are at scale. Children come together prepared for kindergarten, having that same book. So we're actually not asking for it to be a government program. We're asking you to partner with the Dollywood Foundation and the local communities who want to bring this to the areas in their communities to share in the cost as a shared funding model. And second question is on book selection. So the Dollywood Foundation has a blue ribbon book selection committee made up of early educator, brain scientists who have been selecting books for the past 20 years based on a certain rubric of it's educationally component, but it's 0 to 5 space. So it is all about teaching children about love and respect and listening and colors and numbers. It's a national book gifting program so that children who are 32 months of age are getting the same book across the United States. There isn't a difference in books selected for different states. And I'm happy to send a couple of things. I can share the book list over the last few years so that you could see the quality of the books, as well as the rubric of how those books are selected. And if the committee would like, I'd love to be able to share some samples of the books so that you may look at those.
Mr. Chairman, no, I'm good. you kind of lost me at public-private partnerships. For guys like me, I cringe when I hear that word. I just don't like those. But it also does create a state program. Page 2 of the bill, the Wyoming Imagination Library Program is created to be administered by the Department of Education. So we pass this, it's in our books forever. And, you know, the Dollywood Foundation may change hands at some time. They may change philosophy at some point in time. And those books, those blue ribbon books you speak of may change. And they may change on a dime, and the legislature can't change on a dime. So once this is in place, it's in place. And it's going to be very hard for us to undo. Ronald Reagan once said, closest thing to eternal life is a new government program. And they're hard to get rid of, as you can imagine. So thank you for the information. Appreciate it.
Thank you, sir.
Further questions for Nora or Representative Yin?
Mr. Chairman, if I may.
Please, go ahead.
So on the part about it being the book selection, you know, again, this is a partnership, but it's one that is under the Department of Education. And so if the superintendent feels like, who is an elected member from the state, feels like that the book list was not appropriate for whatever reason, I think they can choose to change that contract or change the coordination to make sure that that's appropriate. I don't think I've ever heard from any state that has this, which the states run the gamut across the U.S. that has objected to any of the books on the book list, because it's about 0 to 5-year-olds learning how to read, and really that's setting the stage for our K through 12 system.
Okay, questions for either of them? All right, questions for LSO?
Mr. Chairman?
Yes, Senator Rothers.
On page 2, as we look at the county-based affiliate program definition, I was wondering what clause we could add after that if we did want to clarify that it would be an entity completely under the state's control pursuant to the comment. Any suggestions on how we could tack on a few words and make sure that it's under government control if we chose to?
So I think I would lean on Nora to explain the current counties that have programs and what kind of entities are administering them, to describe maybe what the process would look like for a state program to administer the county programs.
Thank you, Representative Yin. So in order to be a local program partner or an affiliate of Dolly Parton's Imagination Library, they must be a 501c3 and want to desire to bring the books into their community. And at the moment, we do not, it could be a Rotary Club, it could be United Way, it could be a literacy group, it could be a group of retired teachers that create a private 501c3 to do this. It could be a ministry group that has a nonprofit that would like to bring this. Really, the wording should be around meeting the requirements of the Dollywood Foundation to be a local program partner, because they sign a contract with a memorandum of agreement to make sure that they bring the program with the right branding, only these books, registering these children only in the provided database, and managing the data very privately, and doing the fundraising and the requirements that we need from them. So it's really meant to be, as a state program, it's really meant to have like a little bit of almost like an umbrella with the state with the county programs and the local programs underneath, so that they're all operating the same. They're all focused on finding and enrolling children and making sure they can fundraise and sustain their 50%. Thank you for the state's 50%. And then also, as soon as we get to enrollment peak of 65, 70%, ensuring that we're trying to cross-connect families into whatever their family resources or literacy resources they like, the library and other programs. And that's why it's community-based. They know where the families are and they know what the needs are in the community.
So Senator Rothfuss, in some counties, it's run by the library. So in Natrona County, it's the library. In Campbell County, it's the Library Foundation. In Fremont County, it is the United Way. So it is a real varied group of organizations from county to county. And I am hesitant to want to restrict the type of organizations that could be a county affiliate.
Thank you, Mr. Chairman. Thank you, Representative Yoon. That's helpful. Where does, and maybe this is clear in the bill, but as far as the logistics, how does the money flow from the state? Would the state be transferring funds to the county-based affiliate program, which then would pay funds to the foundation, or would it be directly to the foundation?
So I'll let Ms. Briggs answer. Thank you.
Thank you. I'm sorry. In most states, they have found it easiest to contract with the Dollywood Foundation to be able to apply that 50% state's portion matching to the local program partner. So doing all the invoicing and the accounting, will basically act as the fiscal managers for that. So that it would be a contract between the state of Wyoming and the Dollywood Foundation for receiving those funds and managing them and applying those accordingly to the number of children for each program.
And Mr. Chairman, Leader Yin and Nora, what I was trying to think through was a structure that makes it clear that we're effectively paying for educational materials from the educational, from state funding, so that that's what's happening, as opposed to what appears to be contracting with an organization or something like that, which is the end result, clearly, right? We're handing a book to a kid is the summary of what's taking place, or to parents that are going to read it to the kids. So it isn't an education gift. And it's my understanding that all the funds go towards that. I just wanted to make sure that there was some clarity that that's what was taking place. Nora, have you worked with any other states where that face kind of the same concerns that we have with our constitutional structure, to make it clear that that's what's taking place? Or is that something which is a little bit unique to us that we should be contemplating ourselves?
I think maybe some modification in the language. I do like maybe the suggestion that was previously put forward around contracting with, typically it says a national nonprofit, that's set up for the purposes of promoting love of books and reading, which is the Dollywood Foundation. And we try to make this a light lift and an easy lift for you at the state level. We are very good at what we do. And so we'd love the Department of Education to partner with us to provide oversight, but we're happy to do the heavy lifting. And that's why a lot of states have just said, can we lean on you to do the fiscal management and help us with the promotion of the program and find the local county programs. And the oversight goes to Department of Education. So they become part of the team, but they don't have to do the heavy lifting. Department of Education can help us with reaching out to other state agencies, foster care and other programs, so we can ensure that those children have opportunities to get enrolled. So if there's an opportunity to just craft the bill just by adding a few words, then I think that might make it clear, and then also putting in the scope of what we would provide, such as providing the books and fulfilling on the delivery of those books.
And thank you, Mr. Chairman. The thought on that, the one concern I have with adding a contract, which I guess we can ask the Department of Education about, is that suggests to me a procurement process. And, there's nothing more wonderfully bureaucratic than a state procurement process. Is that something that the foundation has experienced elsewhere also, where you end up going through a procurement process so that you're selected to be the foundation that provides this service? Is that an experience you've been through?
Yes, sir. In most states, we've done a sole source document, which outlines that we are Dolly Parton's Imagination Library. The Imagination Library is a registered trademark. So along with state contract documents, we would give you a license to use the name of the program, and, Dolly's name, image, and likeness around that. And so typically we do a sole source. We set up with the Secretary of State to do business in the state, and then go through by setting up any vendor procurement documents. So typically not an open RFP because of the sole source, but I'm not familiar with your processes there.
No, I think that is doable here. Thank you, Mr. Chairman. I appreciate that time.
Go to public comment. From the committee? None appearing. We will go to public comment. Please state your name and who you represent or yours.
Chairman and committee, my name is Kara Hill. I am an educator and I'm here on my own fruition today. I can attest to it not from the legislative side at all, but from the perspective of a parent. I have a 2 and a 5-year-old, and thankfully their preschool teacher and a very adamant librarian in a close neighboring town of ours very much advocated for this program, and both of my kiddos were registered. I say were because my son graduated out of the program this summer. And you can tell that he's very disappointed by that. He was very excited to get mail with his name on it, first of all. Second of all, we live in a rural community, so we're about a half an hour from the nearest library. Also in our community, it's very small, very high amount of poverty. And unfortunately, I look at some of the community members and their kiddos, and I realize that they probably don't have a mountain of books at home. This being directly delivered to their door is a huge, huge perk. Not only does it allow that student to have or a future student to have a book in their hands, but if we're truly looking forward to the secondary level, we're looking at the profile of a graduate, we're looking at our ACT scores, no amount of reading is going to hurt any of that. And that is our state's focus, by my understanding as an educator. And as a mom, I can honestly say it is a huge gift when a 2-year-old can come up to you and say, I think I can, Mama. And that is a gift that came from that first book. So for that, I stand for questions.
Questions? Thank you very much. I didn't catch your name.
Kara Hill.
Thank you.
Yes, sir.
Hello, my name is John Corbin. I am the 2024 State Teacher of the Year. Sorry, this is really important to me. So I'm a little bit emotional, but as a government teacher, Benjamin Franklin once said that an ounce of prevention is worth a pound of cure. I teach high schoolers. I teach high schoolers no matter what background they come from. And when you talk about the impact of early childhood literacy on ACT scores and the impact of those ACT scores on the thousands of dollars our kids can get in scholarships, it's a big deal. Please remember those kids. Not all of them have the same access to funds that everybody else does. When I lived in Lincoln County, I was teaching in Kemmer, and we were lucky. We had a library that worked with this program, and both of my kids got these books every single week, or not week, month. And we loved it. It supported our family. It created an expectation of literacy in our family beyond just being a teacher. but I was also a young educator, and I wasn't getting a lot of financial benefits, we can say that, at that moment. And so having that gift of being able to engage with my kids with an amazing book every month, and they would just grab another imagination library book and crawl up in our laps and ask for us to read it again. It didn't matter how many times they'd heard it. And my kids are well set up. Not everybody else has that. An ounce of prevention is worth a pound of cure. We don't need to be spending a bunch of pounds. We need to be thoughtful about how we use our money and how we value education in the state of Wyoming. And this is something that I feel does that well, not just now, but also in our future. Thank you. I stand for any questions.
John, go ahead. Representative Berger.
Mr. Chairman, thanks, and congratulations, by the way. John, very well-deserved, and read a lot about you, and congratulations on Teacher of the Year. And real quick, in your experience in teaching and education, and you've seen programs probably come and go and come and go, is it true that, is it fair to say that gaining a program is hard, but yet when you lose a program, it's even harder to get back?
Absolutely.
Thank you.
Thank you for your participation.
Thank you.
Please go ahead. Remember to state your name.
Okay. Chairman, committee members, my name is Gay Wilson, and I am a former teacher of 21 years. 12 of those years I were reading intervention specialist here in Cheyenne. And over those years, I worked with students in ages kindergarten through 6th grade. And I was also a home daycare teacher. I had my own home daycare for 5 years and worked with birth through the age 5 and on up. I can tell you over the 21 years, especially the 12 that I did as a reading intervention specialist, I saw the effects of children coming into my literacy groups, not having read before or having been read to. I had kindergartners who came into school who didn't know the difference between a letter or a number. They didn't know the sound of even one letter and weren't even able to recognize a letter. And so I'm here today to support Imagination Library because I know the importance that getting a book at home and having books at home play in children's lives. The 12 years that I taught were all in Title I schools, and I can tell you I had numerous students come in, and we'd talk about the books that their families read with them at home and their parents read with them at home. And I would hear numerous times, we don't have any books in our home. So to be able to provide this service to our families across the state of Wyoming is a true gift that you as legislators can give to all of the families in Wyoming and to make it equitable to all of the children from birth to age 5 within our state. And with all due respect, Senator Beitman, when you said that, do we really want to tie ourselves to this legislation? I look at that as a gift to our state because it's showing the support with the legislators here in Wyoming and the state that you support our smallest children from birth through age 5. And I know you've heard as the Joint Education Committee, the statistics and the facts of getting to children as early as possible. Because it develops their vocabulary, which children who aren't read to, they don't receive them. And I just wanted to read a couple statistics to you real quickly, just to show the importance of that. Children whose parents read to them daily are exposed to at least 290,000 more words by the time they enter kindergarten than those who aren't read to regularly. This number can increase to over 1 million words depending on the amount of daily reading. It also increases their academic performance. Children who are read to frequently are more likely to perform better in school, as we all know. For example, they are more likely to count to 20, write their own names, and read or pretend to read compared to those who do not. Language skills by age 2. A child's brain is as active as an adult, and by age 3, it is more than twice as active. Early reading helps develop these cognitive processes, leading to better language and literacy skills. I know we have a problem with, as big as Wyoming is, with getting to rural students and rural communities and the children in those communities. And this is one way that we can provide that for children. A couple of the things is by age 2, a child's brain is as active as an adult's, and by age 3, the brain is more than twice as active as an adult's and stays that way for the first 10 years of life. According to the Department of Education, the more students read and are read to for fun on their own time and at home, the higher their reading scores are generally. A study of nearly 100,000 U.S. children access to printed materials was the key variable affecting reading acquisition. Children's academic success at age 9 and 10 can be attributed to the amount of talk they hear from birth through age 3. Young children who are exposed to certain early language and literacy experiences also prove to be good readers later on in life. And higher reading exposure was 95% positively correlated with the growing region supporting semantic language processing in the brain. So the sooner we get to them, the better. And so I would highly encourage you to support this program that has been around since 1996. And I did want to share with you, when I was talking to my daughter, who is a high school librarian here in Cheyenne, my 8-year-old granddaughter was listening in. And she was so excited to hear about the Imagination Library. And the reason she was so excited was because she's been a part of that. And this is an example. She wanted me to share this book with you. And she actually wanted to come and testify before you today, but I told her she needed to stay in school. But she wanted me to share this book because this is a book from the Dolly Parton Imagination Library. And she started reading this when she was a little baby. And it still to this day is her and her sister, who is 12. It's one of their favorite books that came to their door from the library. And what's nice is inside, at the back, it even gives parents tips and hints on how to read aloud with their children. And so these books serve multiple purposes. The other thing I wanted to let you know is that this one book, just this one book, has been shared with several hundred other students. My daughter, who's the librarian out at South, she uses it to teach her early childhood, or the early childhood classes out at South High School, how to read aloud to children. And so she shared it with, over the last 3 years, I believe she said 250 to 300 students in 3 years, she has shared this one book with. So it not only just was sent to my granddaughters, which were 2 children, but then it was shared with 250 to 300 students in the high school. And not only that, but then what they will do is, and I'm going to read this off of my daughter who sent this to me. She said they use it out at South High School for their Bison preschool in the spring. So not only will those high school students who have now read this book, they're going to read it with the preschool program out at South High. She said, I've even read it to a few different families with younger children who have come for registration and are waiting for their older siblings to register. All kids, young and old, love this book. Think how many kids just this one book from the Imagination Library has touched over the years. If one book could do that, imagine how many lives investing in the Dolly Parton Imagination Library could touch. And I see all of you and our Wyoming legislators as being part of that gift to our students and our children in all of Wyoming. So I would really highly encourage you to support this bill and to support the Dollywood Imagination Library. Thank you. Any questions?
Thank you. You remind me of a statistic I heard once, that the ACT scores and the SAT scores are directly tied to the number of books in a household. They go up, more books there are. So.
Yes, that is correct. That's definitely, research has supported that. So.
Questions for Ms. Wilson? Thank you for your
Thank
testimony. Anybody else, public comment?
Mr. Chairman, Allison Robertson again. There's a couple things I want to point out. One, when I moved out of my mom's home and traveled to Wyoming from Colorado, I stole one of her books that she read to me as a child every single night. And when my nephew was born, she was like, I can't find this book because I want to give it to him. And I was like, that's my book, Mom. And so this is a great story that involves a book that was just a statement in our home and has so important memories. And even last weekend, I read it to her when she was at my house. And it's just this beautiful moment. When we talk about the easiest way to support teachers, a little bit of money, you've already said $2 million was not that much money, and she's asking for $300,000. That's less than that. And it puts no burden on teachers. How easy is it for you to do something that helps teachers for what you've already classified as not very much money? Respectfully, do we want legislature control or parent control? We put a bill in place that said parental rights. She said on the document that parents get to opt in. We voted down a bill because there were parent rights. She's giving the parents the rights. That's what you've said that you stand for. But now it's political and we're scared to do it. And I think that you have to decide what you stand for. We care about parents. Parents get to opt in. You can take care of our teachers. We can put money you've said is not a lot of money. And this is all really good things. Everyone has a book that you can remember as a child. And I teach high school students, and some of them don't read it even a third grade level. How easy is it for us to provide access to our students from 0 to 5 with no impact on our teachers? They do the work for you. You can find the book list online. Parents get to opt in. That's my statement. With that, I stand for questions.
Thank you. Anybody have any questions for Allison? Anybody? Thank you for your testimony. Anybody else, public comment? Anybody else, public comment? All right, we'll close public comment. Committee, what's your pleasure on the bill?
Sorry, Mr. Chairman, somebody online just raised their hand to
Oh,
provide
great.
public comment.
That'll work. Let them in.
Good morning.
Good morning.
Afternoon, I guess. My name is Ruth Troyanek, and I live over in Laramie. And I work for the early childhood evidence-based home visiting program called Parents as Teachers. And previously, before I joined on with Parents as Teachers 5 years ago, I worked within our public library system for 15 years out of Albany County. My heart is beating with excitement. I was so thrilled when I learned through our Albany County Early Childhood Development Coalition that you were considering this. I really appreciate you focusing on the needs of families with young children in Wyoming, which is the target audience for Parents as Teachers. Our motto is, you are your child's first and best teacher. No one knows your child better than you. And I can't think of a more important tool to help parents be their child's first teacher by providing books as gifts to them. Our program partners and facilitates with parents to help them support their child's development through play and literacy. We are in 5 counties, and we will be expanding into 2 more in the next 2 years. We currently serve 217 families in our state, and we're funded by a federal grant. I want to say that in my several decades working as an early literacy professional, this Dolly Parton Foundation's Imagination Library is a well-respected program nationwide. I don't think there's concerns that it's going to end anytime soon. And as the previous woman mentioned, I think this is a great low-cost way to have a huge impact on families in our entire state, whether they live in one of our larger cities or they're on a ranch in a rural area. I have hoped for years to maybe start this program in Albany County where I live, but currently with my own family who I'm raising, I didn't feel that I could take it on myself. So I am really excited about the idea of the partnerships that could occur here amongst the foundation, the state, and local organizations. I wanted to mention here in Albany County, as I stated before, we have a coalition focusing on early childhood. And I think that that would be the perfect type of organization to help distribute these books in my county. But we also have strong networks in our community, such as the Wild Library System. We have the WIND system from UW that provides online communities for parents with children with disability. So there's a lot of different groups I could see coming together to support this. Also, you might say, well, we have libraries, we have schools. Why do we need to be giving kids books? Well, there's 5 years between the time you have a baby and the time your child is in a school with access to a school library. And as we've discussed earlier, some parents cannot get to the library to check out books for their children. Hence, it's really important for families to have a home library. Repetition of the same stories is good. Kids love this and it helps their brains develop. This program would also give some variety to parents who are getting tired of reading the same book over and over. Also, I've seen parents who feared damaging or losing library books, so they were hesitant to use those books as a resource. And also, it's really normal for babies and toddlers to bite on books or to tear the pages as their fine motor skills develop as they learn to handle a book. So it's important to have books that can get used and abused and enjoyed in each home. Another fact I wanted to highlight in terms of lifelong reading, many of our youth, which many of the teachers who testified today are serving, they are what we call school time readers. These kids, they don't read unless they are in class or they're doing homework. But we know that by reading in the home and establishing a family routine of reading, kids will start to learn the habit of reading at home for pleasure and for the enjoyment of learning. And we know that children who are 1, 2, 3, 4, they just have this innate desire to learn, and they are so curious, and they are just little sponges who want to soak up new information from books and having experiences out in the community. And then finally, before you were discussing the Imagination Library, you were talking about youth mental health. And reading to young children is a huge contributing factor in the social and emotional health of children who will become our future leaders in Wyoming. Reading together as a family supports what we call early relational health. It builds attachment between parents and children, helping them be resilient, leading to strong social emotional skills. And we know that what's simpler than the comfort of hearing a parent's voice read to you? Newborn babies can recognize their parents' voices and familiar songs or rhymes that they heard when they were in their mother's womb. So thank you for listening today. I hope you fund this bill, and are there any questions I can answer?
Questions for Ruth? Anybody? We sure appreciate you zooming in and contacting us. Thank you.
Thank you.
Is there anybody else on Zoom?
No, Mr. Chairman.
Would anybody else like to, once again, one more chance, public comment? If not, we'll close public comment and we will recess and go eat. We'll be back here at 2 o'clock, at which time we'll finish this bill, and then we'll move on to CTE. We'll try to get back on schedule. 2 o'clock. Thank you.